Excellent, thank you. The first thing that we need to make sure that everybody is connected to today is our interpretation channels. We have two great interpreters with us today, Umberto and Austin, who are going to be with us throughout the duration of the meeting. Um, and we really appreciate their time for being with us to be able to make this meeting accessible to all. So if you have not done an interpretation channel before, the instructions for how to do that is on the page. First, please click the interpretation globe icon at the bottom of the screen, of your Zoom screen, and then click the language that you wish to hear. Um, Even if you do speak English, we still need you to click on that globe icon and your interpretation channel. We'll remind each one of the presenters before they start their presentations that we do have interpreters with us today. So staying mindful of your cadence and your speed of presentation. So if you do have any questions about how to get connected to the interpretation channel, our wonderful folks from community engagement are here, and you can engage with them in the chat, and they might be able to help you troubleshoot as well. So again, for those that are just joining the interpretation channels, please click on the globe icon at the bottom of the screen and then click the language you want to hear. All right. So for today, we actually have our first presentation right away at 9:15. And in a few moments, Julie is going to take some time to run through our agency updates and feedback loop from our previous meeting to make sure that everything has been kind of cleared up from last meeting and to make sure that no questions are being asked. So today for our introductions, I'm going to have everyone just do this in the chat rather than coming off mute and saying it out loud so we can continue to move and stay on schedule today. So for introductions today, if you can please share in the chat your name, where you are located, your role, and our fun question of the summer is what's your favorite summer food or treat? So again, your name, where you are located, your role, and what's your favorite summer food or treat? I do know that people come to us in a variety of different ways to this meeting. Some are listening on their phones while still helping actively in their program. Some are able to sit and be with us throughout the day, and some have a bit of a hybrid of both. So we really appreciate everyone joining. As you are able to join. And if you do have the opportunity to go into the chat and introduce yourself, if you're in that position, that would be great. And thank you for those that are putting in your information right now. It's great to be able to see, so everyone should be able to kind of walk through or scroll through that to be able to see. But some really great we have iced ginger peach tea. That sounds amazing. And chilled fruit salad, watermelon. We have ice cream. Let's see, a lot of fresh fruit. Favorite food is Alfredo pasta. Favorite summer treat is a banana split. So a lot of great ones as you're kind of going through here. So please feel free to scroll and take a look at what everybody's saying because there's some good ones out there and some ideas that you might have. I know in the last couple of minutes, we've had a few more people join. So just as one more reminder, if you have not done so already, to click on that globe icon and pick your interpretation channel. All right, Jessica. All right, before I introduce Julie, though, and she does her meeting material review, I do have one more note. We are looking for a co-chair to join Julie and I to be able to help facilitate these particular meetings. We have a great time working with DCYF to put these agendas together and to really help facilitate and be a part of these meetings. So if you feel like that would be something that you might want to uh, do with us, we would love to have you. And so Jessica, can you put in the chat, or Marlene, who they should reach out to? There we go. Jessica just put in the co-chair application. So if you just click on that form, um, we would love to have you or have a conversation about what this might look like to see if it would fit in uh, your program day and the rest of your schedule. So thank you for that consideration, and I will promise you that you will have fun if you are a part of this with Julie and myself and the rest of the community engagement team. So now, before our first uh, presentation happens, I am going to toss it over to Julie, who's going to go through for the next 5 or 6 minutes or so a couple of pieces of documentation from our last meeting and feedback loop before our first presentation. Julie, take it away.
Thanks, Dave. So Jessica, are you able to put up the feedback loop doc? Oh, good. Okay. So I just wanted to note the questions from our last meeting. There was a question about the fire marshal regarding that legislation, and the answer back from them is that they do not deal with zoning ordinances. You'd have to reach out at the local level. They did provide a fire evacuation plan, and you'd have to reach out to CE for a copy of that because it right now is not compatible with putting on the website. Staff qualifications, there were questions about ECAP lead teachers and so many being required to have bachelors, and the response was they are not. They have to have an ECE or equivalent or be on a professional development plan. So under the child welfare presentation, it was asked if there will be a draft payment resource guide shared with providers. And they said yes, and they're going to come back to us in September or November to provide another update. Questions about the legislative budget and the cuts regarding billing. When providers bill, there were cuts, and whether that puts us out of compliance with the CCDF rules. And the answer was yeah, it was actually just below that chart, and below the link it says CCDF rules do not, oh no, it was one down. None of the CCDF requirements prohibit the attendance-based payment system. So, the question around how they arrived at the 91 million, and below the chart that they provided on that, they said that they provide attendance data to the legislature, and the legislature then decided how they were going to implement that. So we're going to go through the agency updates. There's changes coming to the community engagement team. There's some personnel changes and other things happening, but the gist of it is, well, I want to say we're keeping Aaron and and Jessica and Marlene, and the work with CE's work with the advisory groups will not change. So that's all we really need to know. On the rulemaking updates, they provided information about how to make a records request. There's a link. So if you're needing a link from one of these documents, it was sent out in an email, but you can always ask for it to be dropped in here, or you can email the CE team. Let's see, the facilities update. So there's an implementation report that's almost ready. They have worked with a bunch of different groups for recommendations. The new recommendations will help streamline the EC facility development process, technical support, and many other things. The full report will be available on their website, on the Access and Living Wage website. There's also a link for that. So, a lot of these emails have a lot of links that might be of interest to you. Working Connections Childcare, they're having 2 more webinars on the changes, August 5th and 6th. And there's registration links in there. The webinars are very, I did one early on a few months ago, I think, and I think it's a really good idea to attend them if you are not quite understanding the new system for billing, because there is a lot of change there. Dual language designation. It says it's now live, so you can find the resources on the dual language webpage. And the Early Learning Division has provided a lot of links to newsletters and webinars that they've already done. Usually that means there's recordings of these webinars that are available through these links. Sometimes it's just slides, but oftentimes it is a recording. So it'd be good to pull up this email because of all those helpful links. Let's see, the Early Achievers Needs Base Grant, which we just heard about that in all of our emails recently. The subsidy rate increase. There's a webinar, like I said, coming up, but there's also a recording that you can go in and view. So if there's other questions, go ahead and let us know about, either one of these documents. We want to make sure that all the questions get answered. Maybe not today, but they will get answered. All right. Well, Dave, back over to you.
All right, thank you, Julie. And just one more time, as people have joined during the time that we are going through the feedback loop and agency updates, if you have not had the chance yet to click on your interpretation channel, please click on the globe icon on your Zoom screen and then pick the language that you would like to hear. Again, we have Umberto and Austin with us today as our great interpreters. Did anyone have any other questions about either the agency updates or the feedback loop? Please feel free to put them in the chat and or raise your hand. Okay, well, we are ready to go with our first presentation today. Excited to have Matt Judge with us today. He's the Federal Initiatives and Collaboration Administrator. He is going to provide updates on the 2026 Cost of Quality Childcare and Market Rate Study. Matt, thanks for being with us today and for bringing this topic forward.
Thanks, David, and thanks everyone for having me in your meeting. Appreciate the opportunity. David shared with you my role. Just to get a little more specific, I oversee the Child Care and Development Fund grant here for Washington State and at DCYF. And that grant requires that we do a study of this kind in order to set reimbursement base rates for our Working Connections Child Care Subsidy Program. So that's why I'm the subject matter expert about this study at DCYF. So pleased to share some information with you about it today and get some feedback. On the next slide, I'll go through the agenda for this. So I want to make sure that you have plenty of good background and context around this study, and that'll help set up an understanding of its importance and impact on providers across the state. I will talk about the response rate data that we're seeing in the study. We're not yet fully published with the study. It's still undergoing accessibility review. So you're getting a preview of the most important information that you'll see in the study when it's published. So we're going to talk about the rate of response by providers, the market rates, and the cost model rates, which I'll explain soon, the data that we found through this study. And then I'll talk about the next steps, what happens with the study data, and what future studies might look like. And then I have some discussion questions for your feedback, mostly focused around how we improve response rates, because as I'll discuss, the legislature has made some requirements around response rates in order to use this data to update base rates in working connections. Next slide, please. So I want to make sure we have a good understanding of what this study entails. It's really about two things, two methods by which the legislature could choose to set subsidy reimbursement rates. So one is the cost of quality childcare. This is a model that you plug data into around what it actually costs a provider to operate a business based on assumptions about what they need to pay their staff and all of the features of their program. So that's one method that the legislature can use. Another is just to simply ask those providers, what do you charge private paying families in the market? And then set a subsidy rate that's competitive in comparison to what those providers are charging. So right now in law, the legislature sets the subsidy base rates based on market rates, but several states and jurisdictions have been moving to cost models more recently. And generally that entails an increase to base rates. So this study allows the legislature to make a choice either way. I'll refer to cost of quality childcare as the cost model for simplicity going forward. So what we do to conduct this study, we work with partners at Western Washington University's Center for Economic and Business Research, and we survey all licensed childcare providers. So we're talking about just the state-regulated market here. We're collecting data on the rates that those providers charge to private paying families. And then we're also collecting data on rent, mortgage, and utilities. We'll call these fixed costs. And that helps us update the other side of this study, the cost model. The cost model also includes assumptions around the biggest cost drivers in programs like wages for staff, benefits, professional development time, and also the quality pieces in those programs. So we used to be on a 3-year cycle for updating this study. As I'll talk about in a minute, recent legislation says that we're to do it every 2 years. So if it seems like it's very recent that you may have taken this study or seen this report, that's why we're getting on the 2-year cycle with this 2026 study. The last study was in 2024. Next slide, please. So hopefully it's clear, but just to be explicit, this study is what the legislature has used and has put into law that they will use to set subsidy base rates, and they're using the market rate side of this study. They have the option to move to cost of quality or to the cost model if they so choose, but right now it's in law that they'll do so according to market rate. So when you see like the current subsidy base rates and you're seeing variation in by geography, we have the 6 regions plus Spokane, and you see variation based on child age. That's all based on the rates that providers told us that they charge in their region for different children of different ages in their programs. So it all comes from the rate data in the survey. If the state were to transition to the cost model, then the fixed cost data that we got around rent, mortgage, utilities, that would be some data that drives those rates. Next slide, please. So we have some federal rules around the market rate or the cost model, whichever way the state goes. We have to follow some of their requirements. So this study does in that way. We're allowed to, by the federal government has given us permission to move to a cost model if the legislature so chose. We have to ask providers what they charge private paying families in their region. by their child age, and then we have to differentiate by provider type, meaning family homes and centers. When you're doing a cost model, that alternative, you have to uh, uh, also look at regional variation. And just, I wanted to highlight here that providers participated in the creation of the state's cost model. So we had focus groups that gave us lots of information that helped establish the cost model. And then the early educator design team weighed in on what kind of assumptions the model should have for uh, staff wages. So they recommended that the model support a base rate that would allow providers to pay their staff, all of them, a living wage based on the MIT living wage standards, that they would have strong benefits, professional development time, and lots of really high quality elements in their programs. So all that to say, DCYF didn't just design the model alone. We worked extensively with providers on all aspects of it. Again, the state currently sets rates based on the market rate study, but we have permission to move to a cost model from the feds if the legislature decides to do that. So the study will allow us to go either way. Next slide, please. As I said, we have to study and look at variations based on geography, provider type, age of child. We also have to ask providers about whether they accept working connections subsidy and if they have any barriers to that. So that information is also in the study. And then the cost model side just looks at what is the cost of care necessary to meet health and safety, quality, staffing requirements, and the cost of higher quality at different levels. I'll say that the providers that of the early educator design team picked all the highest quality elements to have as base assumptions. So our model has the highest quality built into it as its baseline. And as I mentioned, legislation in 2025 requires that we do this study every other year. I'm seeing some things in the chat. David, I'll take your lead about whether to wait till the end to address any questions we've got here.
Yeah, we have one question so far, but I think that let's wait until the end because it might be part of the discussion questions that you have there too. So, and if it's not, then we'll bring it forward at that time.
Sounds good.
Yep.
Next slide, please. So I mentioned some legislation that's really important for this study. House Bill 2689 passed just this last legislative session, set into law that subsidy base rates are going to be set at 75th percentile of the market rate beginning July 1, 2027. I'll talk a bit more about what that means. But as you may know, the current rates are based on 85th percentile of the 2024 market rate. So that is a bit of a change. Another important piece of law in this bill is setting requirements for participation in the survey. So I want to be careful about how I describe this. What it says is that for each subsidy region 1 through 6 and plus Spokane, in the future, beginning with the 2028 study, we have to achieve a response rate of at least 40%, and that's in each region. And then the response rate has to be greater than the response rate in the prior study. So I guess the thing I would note about this is it doesn't differentiate by provider type. So that 40% requirement is across all both centers and family homes, which is significant. But it does differentiate by region. Each region's got to achieve that 40% level and once it achieves that level, can't go down in response rate. So as we look at the response rates that we've had in the 2026 study, maybe the significance of that will become more clear. Next slide, please. So I wanted to be really clear about market rate percentiles because this gets pretty confusing. Uh, to just state as clearly as I can, 75th percentile subsidy rate does not mean a subsidy rate that is 75% of the market rate or less than the market rate. 75th percentile means the private pay rates of 75% of slots in a region for a given child age are less than or equal to the subsidy rate. That means the subsidy rate is better than most private pay rates. So just by way of example, a subsidy rate at the 75th percentile for toddler care in Spokane means that 75% of families with toddlers in Spokane pay the amount listed for the 75th percentile or less. So in other words, a 75th percentile rate is really strong compared to base rates and is higher, or excuse me, is really strong compared to most market rates, and is higher than the vast majority of those market rates. So once again, 75th percentile is not 75% of the market rate. It's above the average market rate in a given market for a given child age.
Matt, this may be coming further on, but can you share what the response rate has been per region?
Absolutely, that's coming right up.
Okay, perfect. And then have you had a higher response rate from family homes than centers, or is that might be coming up as well?
Coming up as well, it's
Okay,
the opposite, and we'll see that.
sounds good.
Next slide, please. Here's your trusty regional map. You probably know this really well, but just to kind of illustrate, when we're surveying providers, we're getting responses and looking at them regionally to develop regional percentile rates. So when you're in a region, region one, for example, the rate that you have is based on responses from providers, in Asotin County and Okanagan County and all these different counties. And so, in some cases, if you're looking at your rate and you're saying, that's not the rate I charge, it's important to keep in consideration all the different providers of the different geographies and economies that might be in your region. And then you'll see some other regions like King, which is just comprised of one county, or excuse me, Region 4 is just comprised of one county, King. And there's, a much different density of providers in these different places. Next slide, please. We'll get to those response rates in just a moment, but in case you're wondering what kind of outreach we do in order to try to support the response rate, it's pretty extensive. So we email providers at the beginning based on all the information on emails that DCYF has in WaCompass. And this is all coming from Western Washington University. They then mail physical letters the week after. Then they start doing call outs from their call center. And they do several rounds of these calls, each time just calling those providers who have not yet responded to the survey. Then we do email follow-ups to non-respondents a little bit later, mail a physical postcard, another round of emails, another round of postcards. One thing we experience, of course, is that there are some centers that are part of a group of many different sites under one company or one ownership. So we provide an Excel form so that those providers can answer for their many sites in a more convenient way. Then DCYF on our own do a couple rounds of email reminders from our listserv, and then some social media postings. So those are some of the things that go on. We really try to reach out as often as possible without becoming too much of a nuisance to providers. And then on the next slide, I think we'll see those response rates. This is for the 2026 study that ran from October through December of 2025. And I think the thing to focus on here in light of House Bill 2689 are the overall response rate across both provider types per region, because that's what that legislation speaks to. And you can see that it varies quite a bit between the different regions. There's an overall statewide response rate, but that isn't really what speaks to the 40% requirement. It's those response rates in the individual regions You can also see the breakdown comparing center to family home response rates. But again, the requirement from House Bill 2689 is kind of regardless of provider type, or at least that's what the language uh, uh, on its plain, on its face says. Um, I think one of the things to note is that, from Western Washington, we heard that often when they were working with providers to help them complete the survey or answer questions, that when it comes to family homes, they might be answering the survey late at night. They might be answering the survey while kids are in care. And whereas centers may have staff that can, be dedicated to do that work. So I think that's important to consider in looking at those different response rates. Yeah, so next slide. So at this point, you're probably wondering, what did we find out about the change in market rates? So first, I'm just going to go by family homes, then we'll go to centers. What I'll do is list the current rates. So that's what this slide shows. Again, this is based on 85th percentile of the 2024 market rate. So providers told us what they charge in the private market in their region by child age. This is what 85th percentile of those rates looks like, meaning what are some of the highest rates that they showed us. Only 15% of those slots out there in the private market cost more than this. So this is current. So hopefully you see your rate there if you're a provider. Next slide, please.
Matt, can we go the one slide further back to the required percentage for each region is 40%, correct?
Correct. I'd also note though that once you've achieved 40%, you can't go down
Right.
Until you get to 65%. So Spokane there with nearly 60%, we've got to keep getting to that until we get to
So
65%.
so if they went to 57% the next time, then that would disqualify their result.
Under the bill, the legislature they wouldn't be allowed to consider that data for setting the rates.
Got it. Okay. Thank you.
Yeah. So on the slide, okay, so on this slide, the previous slide, we were looking at current rates based on 85th percentile of the 2024 market rates. So then recall that the legislature just said in law that the next rate change scheduled July 1, 2027 will use 75th percentile of 2026 market rates. So that's a bit less competitive with market rates. But if market rates have gone up over the couple of years like we'd expect, then most of these rates would still go up, and that's what we see. So these are the rates that if the legislature uses the 2026 study to set rates, this is what they would set them to under the current law. And on the next slide, I'll show you the difference so you can see how they change. So all of these are an increase, except for the little pink guy there in Region 6 school age. So the legislature, it used to be that no rate would ever go down. The legislature eliminated that. So that would mean that one rate would go down, but all other rates would increase. Sometimes, like in Region 6 infants, that it's a no change, but for the most part, you have change that is pretty significant or smaller changes, smaller increases.
Man, an interesting question that came in. If a region doesn't meet 40% or they go down in the response rate, what happens? Do they redo the survey or do they have to wait 2 years and try again?
Yeah, the legislation doesn't spell that out. And so
Okay.
the honest answer is I don't know what happens at that point. The legislature, I think, has authority to make changes to rates by other methods. Yeah, but the bill says that they shouldn't use the market rate data if they don't achieve that response rate for that region.
Okay.
So I'll do the same now for centers. On the next slide, you'll see the current rates, or pardon me, I almost forgot. I focus on the market rates because that's the way the legislature sets the base rates now. This just gives you a sense of if the legislature would or could move to the cost model rates, what would those look like? And for the most part, I think in almost all cases, that's a substantial increase over rates if you set them by market rate. Just generally, cost of quality care is more expensive. What it costs to provide quality care is more than most families can afford to pay. So if you based subsidy-based rates on cost of quality care, they would be higher than market rate-based rates. Okay, now I'll move to centers and go through the same process. So these just changed. We're now at 85th percentile of the 2024 market rate as of July 1 for centers. And this is what current rates look like under that. And then on the next slide, I show you what our 2026 market rate study shows if the legislature sets rates to the 75th percentile, as is written in law right now, July 1, 2027. And on the next slide, you'll see that that's a bit more mixed in terms of whether that's an increase. For the most part, it is, but with some substantial differences. So what this shows us is that moving from 85th percentile to 75th percentile is a bit of a change, for sure. And then on the last slide here, you can see what cost model-based rates would look like for centers. And again, those are usually higher than both 85th percentile market rates or 75th percentile market rates. Just generally the cost of quality care is more than the market can bear right now. So next slide, please. So next steps. Most important thing, well, from my perspective at DCYF, is to start thinking about how to address the response rate requirements in our next study, because those will go into effect for the 2028 study. We have to hit the 40% response rate by region and not have our response rate decrease for those regions that already did exceed that in this 2026 study. So we're already starting to have discussions with Western Washington University, our partners who help us conduct the study, about how we can streamline the actual survey instrument to meet the requirements of 2689, House Bill 2689. Because I note that those requirements pertain just to the market rates. So if we could isolate that aspect of the study and make sure that all providers respond just to that most critical component that the legislature identified, that seems to me to be an area where we could really strengthen response rates or support providers to respond more frequently. And then we also need to think about the outreach. We already do lots of outreach. We use incentives. But what other strategies could we employ to make sure that everybody knows about and has access to the study? And then we also want to think about the report and lessons learned about how we can improve that. So this should say August 2026. I'll be getting together with Western Washington University in a couple weeks to start discussing these things. So sorry about the typo there. In October 2027, that's when we will deploy the 2028 survey. We're required under law to produce that report June 1st, 2028 and publish that. So the survey has to be point in time, so we would probably conduct it between October and December of 2027. So I think on the next slide, I have some questions for feedback, and this is focused on response rate. Happy to answer any other questions or receive any other kinds of feedback, and either respond here or take some time offline to give you the most accurate response I can. But questions that come up for me about response rate, if you've taken the survey, what changes do you recommend to it that would help boost that response rate, make it easier for providers to respond? I talked a bit about kind of zooming in on the market rate section so that we ensure that providers complete that part so that we're meeting response rate under the legislation for that specific aspect. Obviously, it's always better to get as much response with as much data across as many topics as you possibly can, but the longer it takes to complete a survey, the less likely anyone is to complete it. And the second question there, I don't know how popular a question this is, but the response rates in the legislation are pretty aggressive. And so I think a natural question is whether requiring response to the survey instead of having it be voluntary is going to be necessary at some point or another. And I know that requirements on providers are challenging, but that's a reality that I think we should put out there. And so curious what your response is to it. And then any recommendations for outreach on how to increase participation, and what other provider supports that DCYF hasn't thought of yet might we need to do to increase response. So those are just samples of ways to give feedback. And I think at this point I can open it up for discussion.
Well, thanks, Matt. So if people have questions or comments on the feedback questions that Matt has provided, please feel free to put them in the chat or raise your hand. I think I'll kick off with a couple of thoughts that I was having as we went through this. And these things may already be happening, but I may have just missed them since I'm not directly in one location. So I'm not sure exactly where I find it. But when the survey comes out, could each individual provider's licensor give them an invitation to do it? Sometimes if something comes out via email, especially in a mass email, it might find its way into people's junk folders or other folders that they're not seeing as often. And when it's not a direct invitation, they may think, hey, this might be for somebody else and not me. And I also wonder if that survey may exist, potentially, the link for it in their provider portal, rather than just a link on an email. That might be because people will go to that more often. So that might be helpful. Some other things in the chat, the early achievers coach could be another good way to do it if they have one of those. Renee says maybe there could be a pop-up checkbox in Merit when a provider logs on that asks if they've completed the market rate survey during the window that it is open. Jacqueline has possibly the survey you send, the provider might find it difficult because there are many questions and sometimes they're not very clear. So I think that's to your first one is, how do you make it as simplistic as possible for people to complete? What is DCYF's plan to ensure this survey is equitable, given that the Spanish version, I'm just reading this as well, so I'll let you, given that the Spanish version was inaccurate and failed to provide an equivalent experience for Spanish-speaking participants. The Spanish translation contains significant errors, including response options that did not match the English version, which then compromised the accuracy and reliability of the data collected. What specific steps will DCYF take to ensure that future surveys are professionally translated, culturally appropriate, and reviewed by native Spanish speakers before they're distributed, so that all participants have an equal opportunity to provide accurate feedback?
Yeah, so should I hold back, David.
Yeah, if you yeah, and then there was another comment that says we need questions to be better translated into Spanish. So it sounds like a couple people are sharing that particular piece.
Yeah. Well, I just want to acknowledge and apologize for the issue with the Spanish translation. That definitely happened. We had an issue with we had some providers who really graciously volunteered to beta test our survey, and we found some issues with some of the questions. And then we addressed those, but the changes did not get into the Spanish version. We heard back from Spanish-speaking providers that they experienced those issues that were making it very impossible to answer some questions. So we
Hmm.
course corrected in the middle, but it was in the middle of the survey, and that certainly was an issue for those Spanish-speaking providers. We did work with our vendor, Western Washington University, to correct the issue and reach out to as many Spanish-speaking providers as we could to address that problem, but it came up. So we will certainly work closely with that vendor and be really careful about quality control on our Spanish and Somali language survey versions.
Cool. Thank you, Matt. For providers with multiple locations and programs, should each program fill out the survey or only the programs that have different rates, i.e. center-based care versus school-age sites?
I'm sorry, could you say that question again, David? I think that's important.
Yeah, Renee's saying for providers with multiple locations and programs, should each program fill out the survey or only the programs that have different rates?
So this is really critical. When we're looking at market rates, let's say you have a provider who's got 5 slots of school age, and you've got another provider who's got 1 slot of school age. I'm just picking numbers. We have to weight the response on those rates by how many kids are actually being, how many slots are being served, because we're looking at what's the market in a region. So when we're determining those percentiles, if it's not provider by provider, it's slot by slot. So the answer to that question is we need responses for each site, and then we need to know how many kids are actually being paid that rate, because that's what tells us what that market actually looks like. If you have, 1 slot, but it's a very low rate, that shouldn't be given the weight of 5 slots at a much higher rate. The average rate between those two is going to be weighted toward the slots where there are more kids. So we need to hear from each facility, and we need to know how many kids that slot pertains to, or that rate pertains to.
Perfect. And then Julie has a comment. The survey came out when I was working on rate increases. It would be helpful if it allowed me to put in an estimate about what my rates will be if they are not currently set.
I mean, I think the survey allows you to enter the rate that you see as most accurate for the time that you're being surveyed. So,
And then Veronica, I think Veronica was responding to your last comment. Is this why Region 1 always has less percentage? I don't, Veronica, if you want to jump on to clarify that question, that would be helpful. I don't know if she's able to do that.
Yeah, I stepped out and jumped back in, but by what I
Yeah,
was listening to on the rates, I noticed that typically like region one is less. So my question was, is it because a lot of the surveys that are being returned come back with possibly less feedback than other regions that typically region one is less on the rates for early learning care?
thank you for that question. That's really important. So the
Yeah.
response rate itself doesn't change the rates. It's the base rate or the market rate itself. So if we have 3 providers respond to the survey for an area and they tell us what their rates are, that's the data we have for setting rates. Um, I hope that's clear. So a low percentage response does not mean that the rate will be lower. It just means that the data we have to base the rates on is less. There's just less data out there.
So
So,
how
yeah.
could region one, I know a lot of early learning educators for those regions have very high needs of care. there's a lot of children that need childcare, but the ones that are also caring for them are less. How would Region 1 be able to have the opportunity to have a higher rate than others?
So the market rates in the survey are just based on the data that the providers give us about what they charge in the private market. So if they're telling us that they charge lower rates than other regions do, then that's what's reflected in the percentile charts in the study.
So if I'm hearing right, due to early learning educators not submitting, um, so basically we need to have more early learning educators turn in those surveys so that their rates will increase. Am I hearing that right?
No, there's no correlation necessarily between
Oh,
the
okay.
response rate and what the market rate is. It's just that the market rate data that we have is what the providers in that region told us they charge families. So the only way for those rates to increase is if those providers are telling us that they're charging more for private paying families than they used to.
Oh, okay. So we need to have that area have more input so that they can have a higher rate. That's
If providers that charge more aren't responding to the survey and they started to, then you'd see the market rates go up.
oh, okay. Yeah, I'm just asking because others in that area have that question. Thank you.
Yeah.
Letitia has her hand up, so do you want to come off mute and ask your question?
That was an accident. Sorry.
Oh, yeah, no worries. You're good. And then Julie just said, and maybe this helps, Veronica, I would suggest having a local provider meeting to discuss everyone and increasing or looking at what their rates are. Their private pay rate is what's determining that region's uh, current rates.
Dave, there's Leticia has her hands up. Um,
Okay, Leticia, please, if you want to come off mute. All right, how about Consuelo? Do you want to come off mute and ask your question?
Buenos días. Mire, mi pregunta es, yo soy de Otelo, Washington, y siempre nosotros nos pagan lo más bajito, pero yo les he preguntado a mis compañeras, tenemos un grupo en el WhatsApp y les pregunto que por qué no contestan. Nos dicen que nunca les llegan los correos electrónicos para hacer encuestas, ahorita les dije que entraran a la junta, dice que nunca llegan para ver dónde se meten. Yo tuve que mandarles porque no hay para entrar, nunca mandan. Entonces nosotros, ¿cómo hacemos si no nos mandan, correos electrónicos para entrar a ver lo que está pasando o a llenar encuestas? Porque es lo más bajito aquí con nosotros. Y todos hacemos el mismo trabajo, todas las proveedoras hacemos el mismo trabajo, Pasco, Kennywi, Yakima, Olimpia, todos, Quincy, todos hacemos el mismo trabajo. No se me hace correcto que ganen más otras que nosotros, que es lo más bajo. De nada, muchas gracias.
So, Consuelo, puedes también, como dijeron, compartir mejor afuera de aquí, podemos hacer una junta para poder hablar sobre de esas cosas para apoyarnos más, así no las regiones están equitable.
Oh, sí, muchas gracias, Vero.
Thank you both. I really appreciate that. I'm seeing a lot of comments too, just about not receiving the emails. Matt, and I just wonder, I know that, and I can't speak to the logistics behind the scene, but does DCYF use a for a lack of a better term, like a constant contact or something like that, that is not just direct email, because sometimes that does cause many emails to go to junk folders and things like that that people don't see. And that's why I think those ideas were good about, a checkbox in Merit, putting it in the provider portal, something where people are tools that they're already using anyway, and not necessarily looking for an email that they're not expecting.
Yeah, and I just want to thank you all for that feedback. Right now, we're using the emails that are in WA Compass for the providers, and we know that those are going to spam folders or aren't the contact that is going to be best equipped to do the survey. So I think that's helpful feedback.
Okay. So thank you all for putting those comments in about the emails, because I think that will be a helpful way for us to figure out a way to be able to get this in front of people a little bit better. Let's see. Um, and another thing would be to check the email. Whoever is um, your center director, or whoever is your primary contact for each individual location, make sure you go in and look at what email you originally put in your Merit account. I think that it's surprising sometimes people will forget when they first signed up that it might be going to not their work email, but to a private email or a second private email that they, I'm saying private, but personal email that they've used in the past. So double check the different emails that you may have used originally, because the DCYF communication may be coming to something that you don't expect because you forgot that that was originally the email that you have submitted into your Merit account. Let's see. Yeah, so there was and Matt, this is a comment. I don't know if there's anybody that can address this, or if confusion maybe came at one point, but during a previous meeting, it was stated that providers could charge families less than the amount reimbursed by DCYF. As a result of that statement, several regions have been affected, and it's created confusion among providers. Could DCYF please provide an official clarification on this policy and explain what steps will be taken to ensure that information shared during meetings is accurate, clear, and consistent across all regions?
Yeah, thanks for that. Maybe I'll take that offline and work with our subsidy administrator on how to respond to that.
Okay, perfect. I appreciate that. All right. I think that I have seen hands that have been up, and I think that we have covered the questions that have come through the chat. I appreciate everybody's feedback and comments about how all of this works. And Matt, we really appreciate your time to come and explain how this kind of comes together and what is going to be happening in the future. For those that want to reach out to Matt, his contact info is on the screen. So if you have specific questions about a region or how this process just works overall, if there was anything that was confusing about today's presentation that you want to just get more clarification about, I know Matt is always great to have conversations and respond to people's questions so they're clear about how all of this comes together too. So,
Hey,
Matt, we
Dave.
really appreciate, yeah.
Sorry, I can't find the hand raise thing, but I
Oh,
know that Marlene had that question about the subsidy rate. I think one of the things that's happened is there's some regions that they have very low private pay rates, and they've raised them every time there's been a subsidy increase because they don't want to have to um, get paid less, right? Take a lower rate. So they keep their private pay rate up to keep up with subsidy rates. Now they don't have to do that. They don't have to they don't have to increase their private pay rates to still get paid whatever the going rate is for subsidy. But it also
Mhm.
means that if their private pay rate remains lower, then that's going to affect their market rate survey because the subsidy rate is based on their private pay rates. So, like I said in the chat too, I think Veronica, in my area, I set up a directors meeting before the market rate survey was going out. I knew it was going out, and we had a meeting and we all discussed our rates and we discussed how that was going to affect us. So it's really important for providers to talk to each other. So anyway,
And I think that's followed up as well with another translation that says, I think a good approach is to hold in-person meetings where people can speak up, ask questions, and even review the surveys beforehand. Forming committees to clarify questions about the surveys could also help foster greater participation. So I really appreciate, Jacqueline, you putting that comment in the chat as well.
I wanted
After each, oh, go ahead, Veronica.
I
Sorry.
was as a coach, I did know that educators wanted to maintain slightly the same because they would get in trouble if they did uh, charge more or less, for care. But I do agree. I know I'm going to start a committee so that I can help because I know that a lot of early learning educators have a lot of difficulty getting into emails or understanding the concepts of some stuff, and they would benefit. So I know on my end, I'm going to try to do a committee so that we can work together, as Julie just shared. It's very important because there has been a lot of questions on this. I've even seen it at the union meetings, and unfortunately, many, 9 times out of 10, they do not answer questions and they do not have that support, at least from the ones I've seen. And a lot of providers feel that that's where their voice is going to be heard. And to be honest, it's not. And I know that for a fact. So yeah, I thank you for also sharing your input and what Jackie just shared as well.
Thank you, Veronica. After each one of our topics today, there will be a Menti that pops up, just like what you're seeing on the screen right now. You can use this Menti to put further questions about this particular topic in it. Jessica just put the link to the Menti here. And after each topic today, the Menti will reappear. So you can use it to give feedback about the presentation or ask further questions that will then be followed up in the feedback loop for this meeting. So it will remain open as we carry on. So please, if you have further questions about this topic, put it into that Menti. I also know that during this particular presentation, we had many more participants join us. If you have not had the opportunity yet, please pick an interpretation channel. So when we have questions in English and in Spanish, you're hearing the right interpretation. You click on the globe icon and select the language that you want to hear. Thank you, Jessica, for putting that back up. And again, thank you, Matt, for joining us today and for having this presentation.
Thanks for having me.
Yeah. All right, Julie, I am going to toss it over to you for our next topic.
great, thank you. Just to start off, Jessica, the link for the Menti is going to a weird place. It tells me that you had changed the slide to the one about interpretation. So anyway, I don't know if that's, oh, somebody was able to do it. Okay. All right. So next up we have two presenters. I did see, okay, they're both here. Yay. We've got Eleanor, who I'm going to ask to introduce herself in a minute because I don't want to destroy your last name. And she is the QRIS manager. And Diana Stokes, who is the Quality and Access Administrator with DCYF. And they will provide an overview of early achievers, including its purpose, how the program works, and providers will learn about key components of the process, including timelines, quality levels, recognition cycle, and available supports and resources. So welcome, ladies. Thanks so much for being here.
Thanks for having us, Julie, and happy to have everyone here. As Julie mentioned, my name is Diana Stokes. I'm the Quality and Access Administrator, and I'll hand it over to Eleanor to introduce herself as well.
Hey everyone, thanks for having us here. My name is Eleanor Lauilefue, and I am the CARES Manager here at DCYF.
And as Julie mentioned, we are going to be providing an overview of early achievers. But before we do that, we want to start with a mentee. So if we can have the next slide, we have a QR code, and we would love to know that when you hear the words quality childcare, what comes to mind? And I am going to drop that in the chat as well in case it is easier for you to do it outside of the QR code. So
We're
as
seeing a
we,
lot of,
go
sorry,
ahead.
Diana.
Nope, go
We're
ahead. What are you
seeing
seeing?
we're seeing a lot of comments coming in, trained, positive, engaged kids, high engagement, equitable, honest. And it's slowing down a little bit. So go ahead, Diana.
Okay, so a lot of great words, and I would agree with them. This was not your pop quiz for the day. There was no right or wrong answer. This was just an opportunity for us to understand that when you hear quality childcare, what does that mean to you? So we really appreciate you enlightening us with that, what it means to you. And it's really related to what we're going to be talking today about because early achievers is part of our quality here in Washington State, as it is a form of measurement. So on the next slide, you will find our early achievers vision. And even some of the words that you identified in the Menti are included here. So at our core, we are about ensuring every child and family has access to high quality and a welcoming early learning environment. We want to reflect and have a focus to make sure all families feel seen, supported, and included. And it's not just about meeting requirements. It's about creating environments where children can truly thrive. It's more than just meeting their health and their safety needs, right? We're educators and we really want to recognize that. So everything that we're going to be covering throughout our time together is going to be reflected back to this vision. And as we have a vision, we also have a mission that builds onto it. So our mission is focused on providing an ongoing improvement opportunity for educators across Washington State, recognizing that there's many ways to demonstrate that, and that quality has many ways to show up, and really centers on what do we bring to the work. There's a focus on equity, making sure resources, supports, and systems are designed in a way that's inclusive and responsive to all communities. Hopefully, you have seen some of those changes over the years as Early Achievers has evolved. And then we want to partner with the communities as we continuously not only work towards improving our system, but as we think about quality. And then we're striving to increase transparency and accountability. This then is going to help us with having more equitable, anti-racist opportunities in early learning. And again, we're going to be grounded in this mission and vision moving forward. So early achievers you may be familiar with the acronym QRIS. So that it stands for Quality Recognition Improvement System. In the past, you may have recalled it as Quality Rating Improvement System, but again, this is one of the evolving pieces that have happened. So quality is the foundation of everything that we do. You know, it's where we're honest, having that equitable opportunities that's available for the family, all those things that you said in that Menti board. All agencies that are involved are supporting improving outcomes and supporting high quality early learning environments. And this is about setting expectations and creating consistency across programs. Recognition is led through Cultivate Learning at the University of Washington. They oversee the evaluation process. This includes reviewing the virtual activities and providing the assessment reports. And through that process, this is how the programs receive their quality level as it's reflective of the work that they have done. Improvement is led by Child Care Aware of Washington. They are providing support such as our coaching, training, and technical assistance. And it is through the Child Care Aware of Washington where programs are getting the assistance that they need to grow and strengthen their practices over time. And they partner with their 6 regions as well to provide those services. And then lastly, we have the system. The system itself is guided by DCYF. We are responsible for the overall system, the integration, as well as policy. And then so we think about how does everything work together and align across our agencies. So while there's 3 different agencies part of this work, we all have a different area that we lead, but it's important that we work together in order to support our providers and improve outcomes for our children and families that we all serve. On the next slide, you will see that there are benefits in participating in early achievers. This includes both for providers and families. First, with early achievers, providers are given access to tools and support to improve the quality of care that they offer. This again includes coaching, training, access to resources that will help strengthen the program over time. And it's really about continuous growth, not just checking the box and saying, yep, I've done it, but how do we continue that quality improvement over time? We may be doing this for 20 years, but we still have opportunities, right? We always want to do something different. Things are evolving. So how do we continue to look at our programs? For families, early achievers provides them opportunities to find trusted research-based information about childcare quality. So what does that mean? For them, a lot of parents don't know about child development, so it's important for them to understand when we say a high quality program, what does that mean? Through early achievers, it provides them an opportunity to understand what quality looks like. It helps provide them with more confidence when they're choosing childcare programs. They're not guessing. They have some guidance in understanding their decisions, and it gives reassurance to families that their child's needs will be respected and included, whether it's their skills, their culture, their language, that will be part of their environment and experience. And lastly, that's why it's so important that we have a program that's inclusive and responsive of our very diverse state here in Washington. So early achievers has benefits for both providers and the families. So now that we know that there's some benefits, let's talk about who can participate in early achievers. So there is official RCW language that does state programs that receive state funding need to participate in early achievers. So this includes programs that are receiving Working Connections childcare as a benefit for the families that they serve. and those that are offering ECAP services across the state. When we think about who can actually participate, though, it's anybody that's offering licensed or certified childcare. So this includes our childcare centers, a family home program, an outdoor nature-based childcare program, but you might see ECAP or Head Start part of those programs as well. And so that's where the licensed or certified. You'll also see where tribal programs are invited to participate. With participating in early achievers, you just need to serve children from birth to age 5. While you may serve school-age children, that is not part of early achievers at this time. And then lastly, again, ECAP programs need to participate. That is because they are receiving state funding. So whether the program is licensed or certified, they'll still need to participate. On this next slide, we'll talk about why quality improvement is important. So having a high quality early learning environment not only sets children up for success in school, it helps to improve the health and leads to many positive outcomes in life. Through Early Achievers, we have different areas of focus to help support those outcomes for children. So through Early Achievers, we focus on things like learning environment, child outcome, interactions and curriculum, family engagement and partnerships, and professional development and training. So it's all of these components that are coming together, just like we want to help develop the whole child. We want to help support a well-rounded environment as well. As I mentioned before, we have some system coordination that happens within our different organizations. Next slide, please. This also includes those beyond the 3 organizations in supporting this work. So we have early achievers. Our system of record is merit, but others use CC, and we'll talk more about what that means in a little bit. We have our partners like Cultivate Learning and Childcare Aware Washington, but ultimately, we're all working with children and families because they are helping informing the program and participating along with you, providers and coaches. And it's through the whole system coordination that we're able to be successful as a state program. And I know I've been talking a lot, so bear with me. I have one more slide before I hand it over to Eleanor. And so one thing I mentioned at the very beginning when you saw the QRIS slide, we have evolved over time. In case you don't remember, we had this thing called the COVID-19 pandemic, and it kind of threw us all for a loop, right? We didn't have an SOP to go back to. So we evolved from having this quality rating and improvement system where Cultivate reviewers would come into your classroom. They would do their review based on ECHRS, which was the learning environment, or class, which was focused on the interactions. And we have evolved to what Early Achievers looks like today, because again, COVID forced us to do something, but it's been a prime opportunity to be responsive to what providers and coaches were asking for. So now we're really focused on quality recognition and improvement system. So it's not focused on a rating, but focusing on the great work that's already happening and providing recognition in doing so. So now I will hand it over to Eleanor for the next part.
Thanks, Diana. Next, we'll just go over the operating guidelines document and what it is, including how to use it as a tool and what are some of the changes and revisions with this documents. So the Early Achievers Operating Guidelines defines required participation for mandated providers. It outlines the rules, processes, as well as expectations that participants who are required to participate would need to follow. It also serves as a reference for implementation. This outlines what is required when actions must occur and how participation is carried out. Participants are expected to use this guide to understand and meet program requirements, which includes adherence to some policies, processes, timelines, and expectations. It also clarifies roles, required activities, and performance indicators. These elements are used to determine compliance and participation status. Consistent use of this document supports fair and enforcement across the systems. Applying the same guidance statewide ensures equity and predictability for everyone statewide. The operating guidelines outlines the standard participants are held to throughout their early achievers journey. Next slide. This slide provides an overview of the early achievers operating guidelines based on the most recent version that we just published. Our operating guidelines are now available in English, Spanish, and Somali. So please reference this guidelines that is currently available online to support any early achievers activities. So overall, the updates that we did to these operating guidelines was intended to improve clarity, consistency, and ease of use for providers and partners. Next, we'll look at what participation looks like for both supports, both the supports available and the timelines programs are expected to follow. Joining early achievers, again, all licensed, certified, and certified for payment only early learning programs can participate in early achievers and access the no-cost supports and resources that are available. By joining early achievers, there's a strong support available for licensed childcare providers across Washington state. Early Achievers offers resources at no cost to the provider to ensure there is support throughout their journey. The goal is to strengthen learning environments and support children's growth and development. Some of the supports that are available, depending on your program types, include coaching, training, technical supports depending on program need, scholarships and grants, tiered reimbursements that is tied to quality levels, quality improvement awards, and support with marketing and promotion. So while participation may be required for mandated providers, it also comes with a range of supports designed to help programs succeed and grow. This slide breaks down key timelines and milestones for programs that are accepting subsidy and are mandated to enroll in early achievers. First, providers must enroll in early achievers within 30 days of receiving their first subsidy payment. This is done by submitting an enrollment application in Merit. Next is submitting a request for quality recognition in Merit. This step is a really important one because once that request is submitted, it officially begins the quality recognition cycle. That's what allows providers to start submitting their components. These components are how programs earn points towards their quality level. Next is finalizing a quality level 3 or higher. Providers must finalize at a level 3 or higher within 30 months. This gives programs time to work through components and support quality improvement efforts. Merit will now automatically finalize once a due date is reached. After an initial cycle, providers then must renew their quality level every 3 years. This keeps programs engaged in continuous quality improvement over time. This outlines timeline requirements specifically for programs providing ECAP services. You'll notice that these timelines are a bit more accelerated compared to subsidy-only providers. Programs must enroll in early achievers within 30 days of starting ECAP services. This is completed by submitting the enrollment application in Merit again. programs are required to reach a higher quality level. Programs must finalize at a level 4 or higher within 20 months of starting ECAP services. After the initial cycles, programs then must renew their quality level every 3 years. This ensures ongoing engagement in continuous quality improvement. The key takeaway here is that ECAP programs have a more accelerated timeline in their initial cycle and a higher rate quality expectation, but the overall process remains the same. Engage, progress, and maintain quality over time. This highlights an important option within early achievers for tribal early care and education programs. Tribal programs have the option to use the Love It Way as part of early achievers. The Love It Way is a program evaluation process that serves as both a planning tool and review tool. It was developed by the Aboriginal Head Start Association of British Columbia. Why this matters is because this approach provides flexibility in how quality is demonstrated. It allows programs to use a framework that aligns more closely with the community values and practices. Ultimately, this option gives tribal programs another way to show quality, one that reflects their culture, values, and approaches to early learning. So rather than one size fits all approach, Early Achievers recognizes and supports multiple pathways to demonstrate quality. Next, we'll learn a little bit more of the dual language designation. The dual language designation was established through the Fair Start for Kids Act for ECAP licensed or certified for payment only who can participate in early achievers. What the designation means, it is a formal way to recognize early learning programs that support children learning in more than one language. It includes programs working to strengthen and revitalize tribal languages. It shows that a program is using practices that meets the needs of multilingual children. The dual language designation was launched in 2023, and many providers across the state have identified themselves as offering dual language services or supporting tribal languages. To date, we have received designations requests from over 1,400 programs. This includes 193 childcare centers and 1,275 licensed family homes. When providers requested the designation, it meant that they had children enrolled who spoke the partner language at home or a tribal revitalization program, and that they had a bilingual staff providing instruction in English and a partner language. So there's 2 programs type connected to the dual language designation. Dual language programs which teach children in 2 languages, usually English and another language spoken in the community. Children are learning to read, write, and have exposure to the culture and school subjects. Children in these programs are developing early literacy skills in both languages. Tribal language revitalization programs are sovereign community-led efforts to preserve, strengthen, and reclaim tribal languages. These programs are grounded in culture and teachings and traditional knowledge. So starting in July 2026, which was the beginning of this month, programs will begin completing the required quality recognition components for the designation during the quality recognition cycle. This means programs must be in an active recognition cycle to complete these components. There are 3 main components that are required. So let's get started with the programs that you see on the left-hand side of this screen. All program types, those who participate in Early Achievers, will complete the following components. The first component is completing the existing program profile. The second component focuses on video highlights. Each dual language classroom must submit a video highlight in English and one in the partner language. The final component centers on strengthening and supporting families with an emphasis on collaboration with families using the existing criteria. Standards 1, 2, and 3 must be met to receive the credit. Now let's move on to the information on the right-hand side of the screen. For the Love It Way participants, we want to keep what's working well and build from that foundation. We also know that culture, language, and family engagement are already core to the Love It Way, and they show up throughout the evaluation too. Because of that, the process will look a little different. Instead of completing the program profile and video highlights, the Love It Way programs. Sorry, I will slow down. Instead of completing the program profile and video highlights, the Love It Way programs will continue with their existing approach. And they will complete the in-person Love It Way assessment, a complete action plan for each classroom with a focus on language to fulfill the third component of the Strengthening Families self-assessment. The program must complete one Love It Way action plan focusing on family engagement. The Dual Language and Tribal Language Revitalization Funding Award is part of DCYF's effort to improve access, quality, and stability for multilingual learners in Washington. This means funding will go to programs that are actively using high-quality practice that is outlined in the dual language standards. Effective July 1st, funding will be accessed directly through the Early Achievers Quality Recognition Cycle, so there's no separate application or step. How this works, programs can request the dual language designation during their quality recognition cycle, which occurs every 3 years. Dual language programs may receive $2,100 per site. Tribal language revitalization programs may receive $2,500 per site. Tribal programs receive a higher award because they often need additional time, materials, and resources to support language revitalization. Now I will pass it on to Diana to talk about data.
And I know data is everybody's favorite topic, so I'm really excited to show these numbers because we're at the highest level of participation in early achievers that we've ever had. And that is really, really exciting for those who have been around a little while, like me. We know when early achievers rolled out, we were not in that place. It was more about please, please participate. And now we're so excited about the participation levels. This visual here shows the number of programs who have finalized their quality level, as well as breaking it down by region. And as I mentioned, we continue to see a high growth in early achievers, and this just kind of reflects of where people are at in their quality journey. So the breakdown of the coloring is that green color is a quality level 2. Blue is the quality level 3. That's where a lot of the programs are at. We have a quality level 3 plus, which is the orange. Teal-ish color is our quality level 4. And we have over 186 programs that have received the highest level, which is a quality level 5, which is fantastic. And we love to celebrate those programs as they hit that milestone. You'll also see that we have 2,224 programs that have finalized a quality level, but that doesn't factor those programs that are in their initial quality cycle. And with that thing I mentioned before, that COVID-19 pandemic, there was a timeline extension. So a lot of people are still in their initial cycle from when they started before that thing happened. So we still have more that will be rated the next time we can hopefully share these type of numbers. And we get to see these on a weekly basis, which is really fun to see the growth and the transition. This next slide is a more concentrated view and a breakdown of where these programs are at. And we'll go over the cycle momentarily to understand what does it mean by program profile or video highlights. But this just kind of showcases where programs are focused on. And you can see those numbers. Program profile will have the highest because that is the very first step once you've enrolled and submitted your request for quality recognition. And then in the second graph there, it breaks it down by regions and where they're at with submitting components. Sorry, I get really excited about numbers, especially when they're good numbers like this. So as we go into the next slide, we have another Menti board for you. And we've kind of talked about quality and what this looks like within early achievers. But if you could improve one thing in your program, what would it be? What would you focus on? And then Eleanor will read some of those back as they start coming in.
We'll give everyone some time to respond. We're seeing transitions.
Oh, that's a good one. Those are always so hard.
Staff retention.
Yes.
Staff. More time for training. These are all really good responses.
If I had my magic wand, I would make it happen if I could. But I also need to plant that money tree as well. But these are all things that we talk about with early achievers and provide supports on. And that's where the quality level also comes into play because it reflects the work that's happening. So the staff that you do have play a role in early achievers. They all are contributing versus before, they would be observed or set up their learning environment and we would reduce ratios and, we would do these things to support them. But now they really get to showcase their expertise, and that dual language opportunity is also a great way to pull in the culture and experiences of the teachers that you have as well. So on the next slide, let's understand, what does a quality level actually mean? And, we talk about quality level 2 or quality level 5, but the quality level is how we show a program's commitment to continuous quality improvement in early care and education and setting clear goals. So throughout the process, both the teachers as well as the administrative staff, whether it's the family home licensee or the director, assistant director, program supervisor, we're all setting goals on what do I want to improve, whether it's in my classroom or the whole program. All programs that become licensed start as a quality level 1. You may remember from, again, back in the day when we had standards alignment, we had a pyramid and it was licensing provided the foundation. Then you had early achievers. So we were a step above as we're thinking about quality. And then we had ECAP and like Head Start, where there's additional standards on top of those licensing ones. So as programs move through early achievers, they're going to go between a level 2 and hopefully working up to a goal of having a level 5. And this is done through earning points through the quality recognition cycle. And as Eleanor mentioned, that is a 3-year cycle. On this next slide, we are going to kind of cover some of those logistics of the quality recognition cycle. So these are good for 3 years. The first initial cycle is the only time that you have a different amount of time. So as Eleanor mentioned, if I am not offering ECAP, I have 30 months to meet a quality level 3 or higher. Then I have 24 months or 2 years to get to that quality level 4 for ECAP. That's the initial cycle. From then on, everybody has 3 years to either maintain or continue advancing in their quality levels. Programs need to remain active throughout the recognition cycle. So this means continuing to work with your early achievers coach, setting action goals and plans, and just working on what you want to do. And you can pick a very focused item or go a little bit broad. It really is a provider-led experience now. And then once a program completes their quality recognition cycle, that's when they receive their level. As Eleanor mentioned, there's a mandated level, but we get a certificate once it's been finalized. If you're licensed, it gets updated into Child Care Check, so families can see that if they are looking there for access. But then we go into our next cycle. So once I've finalized, it's time to move forward and start with another request of quality recognition application. So this next slide is where we kind of start making sense of what those bar graphs mean. So I've mentioned what early achievers looked like previously, but this is really focused on what early achievers looks like now. So I submit my request for quality recognition. Great. I get assigned an early achievers coach. I get a community liaison from Cultivate Learning, and these are my buddies that are going to be part of my journey the whole entire cycle and beyond. The very first thing I'm doing is I'm submitting my program profile. That's why this bar graph was the longest line, because again, this is the very first step of early achievers. The program profile is where we're entering data into the system. So who are my teachers? What are the ages I'm serving? This is an opportunity for teachers to complete a staff survey, and then you also can get survey with your families. With that cycle being 3 years, it's a great opportunity to then see additional information in the future to say, what are my families saying now, especially if you have those long-term families. Next, we go into video highlights. This is kind of the equivalent of what class in Eckers was previously of the observation. Instead, this is done either in partnership with your coach, with your co-teachers or administrative staff helping, but it's a 10 to 15 minute video that is highlighting an activity that you're doing with the children. For the first videos, you get to pick what the activity is. If you're a dual language program, you would submit one in English and a second in the primary language. There's an opportunity to submit 6 videos, but as we talk about that minimum quality level 3, in order to get that, I have to complete program profile and 2 video highlights per classroom. That is it. So keep that in mind as we're going on our journey here. If I want to, I can submit records review. This is where I am bringing my policy handbook into place. I'm including other things like training requirements and having those documentation. This is kind of the paperwork side of things. And this is uploaded into CC, previously known as Coaching Companion. Optional, if you have an accreditation like NAC, NEYC, Family Child Care Association, that can be an opportunity for additional points. And then lastly, professional development. So what education does your team have? So again, accreditation, professional development, and records review are not required to have that quality level 3. Then we finalize and we celebrate what level we received that recognizes all of the hard work that we've done. We take a breather, we celebrate, and then we keep on going. What else do we want to do within our program? How else do we want to support ourselves? And then you partner with your coach and kind of talk through that as you continue your next cycle. So as we think about how do I finalize this level, next slide. There are just a couple components you have to remember. So minimum, I have to complete the program profile. That is where you're going to get the minimum amount of points, but unfortunately not enough to get to that quality level 3. You got to do those 2 video highlights as well. We need to have a non-expiring license in good standing. So if you're on probation and under review, we would need to wait until that is complete before you could move forward. For ECAP programs that are not licensed, they just need to be certified in good standing with the ECAP team. Then we want to make sure we're at least a quality level 3 or higher. And then just really ensuring that you have done this because it does impact the next steps for your program. If you're not able to meet the quality level 3 or 4, if you're ECAP, you will get an additional year. It's called remedial activities to continue to build on what you have and finish what you need to get to those additional points. One really great feature, and sorry, Eleanor, if you're going to talk about this next, but in Merit, you're able to see your projected points throughout the whole journey. So you can know where you're at in your early achievers of like, do I have enough points for a level 3? Oh, wait, I'm really close to the level 3 plus. Let me do a little bit more because I have time and I want to do that. So that's a great opportunity to follow along as well. But sorry, Eleanor, if I stole your thunder, but I'm going to hand it to you to talk about systems.
Thanks, Diana. So we'll take a little bit look at about all the systems that you as a participant, you will actually go through as you participate in Early Achievers. So Early Achievers participant uses several online systems to track information, get support, as well as complete required step. Merit is an online system for early childhood educators. Merit is a system of record for staff employments, education, and qualification. The Early Achievers contact must ensure that all early learning program staff have entered professional records in Merit. Staff must associate themselves with the early learning programs by logging into their own Merit professional records and entering their current employment information. Site supervisory staff are required to verify employment records in Merit using their facility or site tab in Merit. Merit was enhanced so that if a participant's quality level due date is reached and they have not finalized, Merit would do it on their behalf. The purpose of this update is to make sure that Early Achievers supports compliance with subsidy requirements, streamline the process, and remove some administrative workloads, as well as ensure that the quality and accuracies of Early Achievers data. Next, we'll talk about some key features that we want to highlight, which is auto withdrawal. Merit will now auto withdraw a participant from early achievers if they have no points at the time of finalization or they do not meet their mandated quality level after completing remedial activities. Remedial activities is one of the new changes that happened to support auto finalization. Is that providers will now be notified as part of their finalization email if they did not meet their mandated quality level for their program type and need to complete remedial activities. Merit will now display their remedial activities due date in the provider's early achievers timeline view and automatically submit a new request for quality recognition application so they can immediately begin completing components for their remedial activities. Another nice feature are certificates when a quality level is finalized, either by the provider or the system. Merit will now include a quality level certificate in the finalization confirmation email. These were previously manually created and sent out to improve efficiency. This process is now automated so providers can get their certificate in a more timely manner. Now we'll talk about the Coach and Educator Community Interface, also known as CC. This system is managed by our external partners over at Cultivate Learning of University of Washington. It's an online system that supports professional development and gives provider access to training, coaching, and resources. This is also where providers do their work within early achievers. Providers will submit their program profile and video highlights, among other things. Once those components are submitted, they're reviewed and monitored by our partners at the University of Washington's Cultivate Learning team. So really, this is a central place where providers can access supports and submit their work that contributes to their quality level. Next, I'll pass it on to Diana to talk a little bit more about supports and resources that are available to the Early Achievers participants.
Thanks, Eleanor. And we'll go ahead with the next slide. As we mentioned, there is coaching services available at no cost. So remember, no cost, free. So take advantage, but you, as seeing in the chat, you can always explore other options. It provides financial incentives. So access to like quality improvement awards and subsidy. There's quality initiatives as well. We have the quality improvement plan that helps with keeping going with the cycle. There's professional development opportunities, and this is connected to both training and working with your coach. And then we have resources like people. In addition to your early achievers coach, I mentioned you're going to have a community liaison at Cultivate Learning. And then within DCYF, we have our system navigators and our early achievers team here ready to support you all. Additionally, we have a lot of tools posted on our website. Next slide. I'm going to drop the link that I provided earlier as it's going to have a lot of this information there. It's going to include things such as our quality improvement award. What is that subsidy quality incentive? There's an FAQ, tiered reimbursement for those that accept subsidy. There's access to scholarships and needs-based grants, and those are connected to your early achievers participation. Additionally, there's resources such as birth to 3 specialized infant and toddler coaching supports. You have access to mental health consultation if you are early achiever participant as well. So it's really a robust support system today. On this last slide, because if you're still holding on with us, we're really hoping that you took something away from today's presentation. So our next question for you all is, what is the one thing that you're taking away today that you can apply to your program? Whether it's exploring early achievers more, maybe coming out and learning about it, you're participating. I've seen a lot of great stories in the chat, but we'll give a minute for you to respond there. And just for acknowledgement, the last slide is going to be our contact information. But I do, David and Julie, want to kind of open it up for a few questions. I know we're getting short on time.
Well, there were a few questions in the chat. Janelle had asked about the feedback to providers. It is hard when you don't know. So let's see. Is there an effort to improve feedback to providers on records review section? Currently, we get points or not on areas we opted into, but zero actual feedback explaining areas where we didn't get the points.
So just like Early Achievers as a program and asking providers to go through the quality improvement process, we are doing the same thing. So we do continue to look at our processes for improvement, looking at our policies, where can we be more transparent and clear, where can we refine to be more supportive. So we do continue to work on that, Janelle. Thanks for asking that. I see the question about the number of providers that accept subsidy versus participating or rated in early achievers. I do not have those numbers off the top of my head. So in the feedback loop, we will make sure to have that information included.
Okay, so Marlene translated a comment in there about those of us that uploaded the 6 videos and are only just now finding out. Is that something you can comment on?
Yes, so with dual language, the designation, you do have up to 6 videos you can submit for early achievers. If you've already submitted all 6, you will be able to do the designation then moving forward in your next cycle. We are not able to delete submitted videos in order to replace a new video unless it was a video that was kicked back because it didn't meet the eligibility requirements or had something like a bare bottom exposed.
Okay.
Consuela has her hand raised too, Julie.
Oh, I'm sorry. Consuela, did you want to unmute there and ask a question?
Oh, disculpe, yo ya hice mis videos, pero yo pasé el tercer nivel, me quedé en el tercer nivel, pero ya después que nos acaban de informar esto, ¿qué va a pasar con nosotros? Porque nos acaban apenas de informar esto hace días y me acaban de decir que ya pasé el tercer nivel. ¿Por qué no se nos comunicó antes para haber hecho los demás? Esa es mi pregunta. ¿Ahí qué va a pasar con nosotros? De las que ya hicimos los videos, ¿qué va a pasar con nosotros? De las que ya hicimos los videos, ya los mandamos. ¿Ahora qué podemos hacer? Ya no nos van a dar chance hasta en 3 años.
So thank you for that question. It is every cycle that you would be working towards that designation. If you email us, we can look at your account specifically to provide details. There has been communication going out. I suggest checking out the dual language webinars that we just had last month as well. But send us an email and we can get clarification out there, and then share the different newsletters that it's been sent out in.
Ok, gracias.
De nada. I know we're like a minute over time, so I just want to say thank you all for having us today. This is the first of hopefully a series where we can provide more clarification. So please fill out the feedback information so we know what you want to know more about for early achievers. And we will see you all at the next time. Thanks, Julie. Thanks, David.
Thanks. And thanks so much for being here. You know, I just want to say this is an opportunity to come and ask questions. And sometimes our questions are new to them. And that's why we have our feedback loop. If there are questions that presenters were not able to answer, then we follow up with that and the answers are provided in the next meeting. So anyway, thanks for being here, guys. The Menti for...
¿Cuántos videos en inglés se
Oh.
necesitan subir?
I'm sorry, can you repeat that, please? When we go over the feedback in the next meeting, yeah, you know, I haven't really, Jessica and Marlene, when the feedback is sent out to everyone on the committee and all of the participants that you guys are expecting, is it in English and Spanish? I didn't even look.
I think her question is about the early achievers videos. How many can be uploaded in English? Am I correct? I don't know who asked that question. Leticia?
Sí, sí, ¿cuántos videos en inglés necesitamos mandar y cuántos en español?
So I'm happy to answer this question really fast, but we'll come prepared with more dual language for the next piece of the series, as there seems to be a lot of questions. One of the videos needs to be in the partner language. The other ones would continue to be in English. I appreciate the questions. We'll make sure we have resources for you to access as well when we complete the feedback loop for you all. Unfortunately, we're out of time, as I want to make sure my next group has the time as well. So thanks.
Thank you. Thanks so much for being here today. So we'll just jump right into it. We can always do more feedback on this in the Menti. You can talk about any presentation when you do the Menti. So Dave?
All right, thank you all, and thank you, Diana and team, for that presentation. Like Julie said, please continue to. That Menti link is going to stay in the, and Jessica can put it in there again when she has a moment. But please feel free to put additional questions. And I am really excited that we're hoping to have an early achievers, kind of series that's going to go on. So it'll be nice to keep that coming forward to be able to have these conversations. Okay, this is going to be our last presentation before our short break at noon. And so I am excited to introduce several representatives from OSPI, ESDs, CCA of Washington, and DCYF, who will inform members about the collaborative recruitment efforts aimed at ensuring every child has equitable access to affordable, high-quality childcare and early learning programs. So this is part of DCYF continuing to partner with statewide organizations to support Washington's mixed delivery early learning system and promote informed family choice. So as a reminder for all of our presenters that we do have Umberto and I'm sorry, I forgot Austin, who are translating for us today. So keep that in mind for your speaking cadence as you go through your presentation. And I'll let you guys take it away.
Thanks, David. Hi, all. It's Diana Stokes again. Uh, we are here today to talk about coordinated recruitment and enrollment. I've got some partners here that will be joining, so fortunately you won't have to hear too much of me of this next hour. And they'll all introduce themselves here shortly. But throughout this time, you'll hear from our partners at the ASEDs, so the Association of Educational Service Districts, other team members here at DCYF. We have OSPI, so the Office of Superintendent in Public Instruction, as well as our partners at Childcare Aware of Washington. Our goal is really to share what is coordinated recruitment and enrollment. How do we all support this work? We have this thing you may have heard, family access managers through Childcare Aware Washington. You'll learn what does that mean and what do they do. We're going to talk about Childcare Check and Childcare Finder, two similar resources for families to find childcare across the state. We'll provide a demo of Childcare Finder, and then we're going to wrap it up with any questions that you may have. For this first little bit, I wanted to provide an overview of just what coordinated recruitment is, as it was brought to us not that long ago in legislation, but it's not a new work that's been happening. We've all been working towards how do we best serve families and provide them access to the type of care that they want and need. So in, I believe it was 2021, we had this legislation passed with the second substitute House Bill 1550 that really provided some actual direction of what does coordinated recruitment and enrollment look like. And we're really grateful to be working with our partners to have a statewide initiative to support this work. I believe I am handing it off to Tasha next. If you're
Thank you,
here.
Diana. Again, Tasha Jorgensen, the Coordinated Recruitment Enrollment Coordinator from DCYF, and who is really engaged in this work? Everyone's engaged in coordinated recruitment enrollment. Specifically, we have agencies and organizations that come together and meet monthly, and then do work together with OSPI, Childcare Aware of Washington, the ESDs, and then ourselves, DCYF. So really looking at transition to kindergarten, special education, those family access managers that we partner with Childcare Aware of Washington, and Family Center. At the ESDs, we're really working with the school districts, and happy to have Matt Bona here today to help do our presentation with us. And then DCYF, we're really connecting internally with Child Care Subsidy, the SWELLEN, so the Child Welfare Early Learning Navigators, our coordinated recruitment enrollment team, Diana and her team, as well as myself and Melinda Barnes, who you'll be hearing from as well. Early Achievers, ECAP, the Head Start Collaboration Office, and then Tribal Relations, the Office of Tribal Relations. That's who's engaging statewide currently. And then what is coordinated recruitment enrollment? Again, we're here to support family providers and agency partners and really coordinating how to do that informed family choice. And kind of like educating families about what options are out there in our mixed delivery systems for early care and education, as well as supporting partners and coordinating recruitment, eligibility, enrollment, all of those together as well. Next slide. Okay. We really feel that coordinated recruitment enrollment is important here in Washington State to empower families again to make that informed choice about what is best for their family, and how that we can align these programs, or families can select programs that align with their child's strengths, needs, family values, culture, language, and financial situations. So, what options are out there for them? And then how do we help them find and learn more information about them? Next slide, please. First off, we get Office of Superintendents of Public Instruction, because I just say OSPI, and then I have to remember how to say all the words. We have Letitia Conley here to present. So Letitia, go ahead and take us away.
All right, perfect. Thank you so much. And thank you for laying the foundation of what the CRE work is about. So I just want to start off by saying hello to everyone. My name is Letitia Conley, and I am the Early Learning Program Supervisor here at OSPI. As a part of my role, I support school districts in implementing and strengthening transition to kindergarten. OSPI supports coordinated recruitment and enrollment by providing guidance, resources that strengthen collaboration among school districts and community early learning partners, helping to ensure families are connected to the early learning option that best meets their needs. So today I will be sharing with you some of the resources that support TK programs. One of them is the TK Minimum Standards and Requirement document. And this is a local needs assessment that all TK programs must submit. They're required. And so this is the first step of beginning that process. Another is our TK site visits. So we go out into the communities, into the school buildings, and we connect with our programs. And we also provide feedback during those times. We're also able to discuss what does CRE look like in their district and their region. And OSPI also uses a landscape survey to help gather that information as well to strengthen that CRE process. Thirdly, I want to talk about the CRE planning worksheet. And the goal of this worksheet is to efficiently plan and reach children who do not have access to high quality learning before kindergarten. And lastly, I will talk about our TK readiness consideration. This document emphasizes the collaboration between early learning providers, including the coordinated enrollment practices, and having clear communication to the families and the partners in that community. So I have literally just given a few high-level resources that are provided to our districts. There are several more that are on our website, but today we just wanted to touch on a few of those. So thank you so much, Tasha.
Thank you, Letitia, for coming and doing the presentation with us, and really enjoy getting to spend this time in the work that we do together. I forgot, and I think Diana we forgot to mention that we are going to keep all the questions. Please put them into the chat as you feel. At the end of the presentation, we will answer questions then. And then with that, we have Matt Bona here from the ESDs.
Morning, everyone. My name is Matt Bona. I'm the Executive Director of Early Learning at ESD 123 in Pasco. Some of the ways this new system will help ESDs along the lines of storing data, visibility, and planning power. We'll be able to align and share enrollment pathways that create real-time regional view of early learning demand and capacity. It will also provide clear insight into vacancies, enrollment trends, and eligibility gaps across the different programs in our state. Moves the system from fragmented reporting to more of a cohesive, actual data picture. It improves forecasting accuracy for staffing, slot allocation, and program expansion. It also will help ESDs and partners target investments where need is the greatest in regions rather than relying on delayed or partial data that we kind of operate with now. It also strengthens grant reporting and accountability, especially when it comes time to ask for slots and different things like that, with consistent integrated regional data narratives. And then finally, it supports more responsive decision making, identifying issues earlier, not after enrollment cycles are done or closed. The next thing it will help with is shared recruitment and outreach infrastructure. ESDs will be able to serve as coordinating hubs for regional recruitment efforts across providers and programs. It will also enable joint outreach campaigns instead of isolated or duplicative messaging. We'll build capacity for multilingual, culturally responsive family engagement. It also will create consistent messaging so families experience early learning as one connected system within our regions. It will reduce confusion caused by competing program identities and entry points, which has been an issue for many years. It also will strengthen partnerships with community organizations, schools, and local agencies. And then finally, with this point, improves access and equity by making early learning opportunities clearer, more visible, and easier to navigate within our regions. That's all. Thank you.
Thank you, Matt. From the DCYF, we have Melinda Barnes.
Hello, everyone. My name is Melinda Barnes. I'm the Coordinated Recruitment and Enrollment Specialist with DCYF, and I am going to talk through the DCYF CRE team's work, both internally and externally, for coordinated recruitment and enrollment. So the DCYF CRE team began in July of 2025, and since then we have been intentionally strengthening our connections and building relationships across internal DCYF work units. These partnerships are foundational to developing a coordinated statewide CRE system that is responsive, equitable, and effective. We know that early care and education is complex and multifaceted, and no single team can do this work alone. By collaborating with subject matter experts across DCYF, we're able to better align our efforts, share data and resources, and gain a more complete understanding of the needs of children and families. This work is critical because families often face fragmented systems that can be challenging to navigate. Through stronger internal coordination, we can reduce barriers, streamline access, and ensure that children and families, especially those who need it most, are connecting to the right services at the right time. As part of this effort, we are identifying existing CRE-related work and developing clear coordinated pathways across DCYF to improve access, consistency, and outcomes statewide. Here are a few examples of the work units the DCYF CRE team is connecting with. We have Early Childhood Education Assistance Program, also known as ECAP, Child Welfare Early Learning Navigators, also known as SWELLENS, the Early Learning Facilities Fund, or ELF, Child Care Subsidy Team, as well as Head Start Collaboration Office. Externally, on September 16th of 2025, OSPI, CCA of WA, AESDs, and DCYF held the first CRE Core Advisory Team meeting. This core advisory group meets monthly to work in partnership on the strategy and direction for the statewide CRE framework and collaboration efforts. Each month, we feature a spotlight. This creates a pathway for agencies and organizations to share information with one another. A few examples of the statewide framework we're working on include creating shared communications about CRE, creating shared CRE language, and creating opportunities to share resources and materials Our work also includes developing a shared understanding of the barriers families face when accessing and obtaining early care and education programs. We recently started the CRE work group, and the objective of this work group is to collaborate with statewide early care and education work group members to support informed family choice for CRE and to share information about the early care and education sector. And next slide.
Thank you, Melinda. Next, we have Rob from Child Care Aware of Washington.
Thanks, Tasha. Hi, this is Rob Columbini. I'm the CEO of Child Care Aware of Washington. Thank you for inviting us to be a part of this today. I've got a whole great team behind me that are wanting to talk after me, so I'll be quick. But I know that we know every family deserves a simple, welcoming, and coordinated experience when looking for childcare and early learning opportunities. Child Care Aware also realizes that families shouldn't have to figure out a complicated system on their own. And so our goal is really to help navigate those systems. CCA WAS supports families in understanding their options across the mixed delivery system and their eligibility for programs and subsidy. Our work is about making that system easier for families to navigate. And we do that through strong coordination between the Family Center, Child Care Finder, which you're going to see a demonstration of from our staff in a few minutes, and then also from our family access managers. And Gracie and our team is going to talk about what those folks are doing within the state in our regions. Next slide, please. I think the other thing to remember is that there are many pathways, but there's one coordinated system. Families have options to choose the program and the setting that's really right for them. As you can see in this screen, there's many options from Head Start, which is, pregnant moms all the way up to children up to the age of 4. We've got tribal, we've got family, friends, and neighbors. And then we've, of course, got ECAP, our state-run preschool, as well as licensed certified carers, which are in centers, family child cares, outdoor care, and then some school-age care. Along with that, we've got developmental preschool, transition to kindergarten, as well as private preschools and kindergartens across the state. And then, of course, we've got our license exempt care, which are cares that are provided by blood relatives or step relatives or other folks that are providing care to children across the state, as well as, and last but not least, our military operated childcare. So again, it's looking at all of this and realizing folks have a lot to choose from, and how do we help them make the choice that best fits for them and their family. Next slide. I'm going to pass off to Gracie to talk a lot about our family access managers.
Yeah, thank you, Rob, for the overview. Hello, everyone. Good morning. My name is Gracie Martinez. I serve as the Family Access Program Manager for Child Care Aware of Washington's coordinating office. My role is to ensure alignment for the statewide Family Access/CRE work plan, our contract scope and priorities. And in addition, I serve as a communication bridge between the DCYF CRE team and the CRE core team with our CCA regional family access managers. Building on what Rob just shared, I want to walk you through the regional side of this work, specifically to the role that our FAMs, our family access managers or coordinators, play in the field. With coordination at the state level, our family access managers or FAMs focus on regional work across 3 areas: community engagement, family support systems, and early care and education providers. The next several slides will walk through each of those in turn. For the, actually, can you back up to the community one, please? Thank you. For the role with community, our family access managers serve as systems connectors and community partners, building cross-sector collaborations and collaborate in partnership with DCYF across our statewide early care and education and community-based organizations. There's a key emphasis on building strong, trusting relationships with community partners and local leaders, convening partners, facilitating cross-sector collaboration, and champion equitable, community-driven solutions for CRE. Another part is to understand the local needs, service gaps, barriers, especially for children and families who may need it most, and represent CCA of Washington in local, regional, and statewide settings. In addition to that is sharing regional best practices and ensuring that the coordinated system remains locally responsive. So that community-facing work sets the foundation for this. Now let's talk about how they support families directly through our broader family support systems. Next slide, please. So our FAMs connect regional experience to statewide system design, working at the intersection of data, family voice, and cross-system partnerships. Our FAMs support systems that create equitable access to high-quality early care and education for families, and they serve as a critical bridge between regional work and the statewide work that's happening as we speak. One of the key emphasis here is they use data, family voice, and tools to track trends, inform decisions, and develop informative reports on their respective regions. They are helping design and implement the statewide CRE framework and workflows to prioritize family choice while supporting access to inclusive early care and education. They identify family needs and trends, including those coming through the Family Center, our toll-free online resource and referral line that is statewide service. They also work closely with our Family Center staff to ensure resource data is accurate, updated, and reflective of regional realities while honoring the providers. They act as that support link for Family Center staff working with families who require additional assistance beyond what the Family Center or with what Child Care Finder self-navigation provides. Helping folks just kind of troubleshoot any type of barriers or understand the options. Families are just a piece of this. FAMs are just as engaged with our early care and education providers. Next slide, please. So our FAMs strengthen partnerships. They align systems, share clear information, and engage providers to communicate and collaborate across the early care and education mixed delivery system. The key emphasis here is to build and sustain collaborative relationships across the early care and education mixed delivery system. You'll hear us talk about that quite a bit. It's a huge term. They also work at strengthening existing early care and education networks by coordination and collaboration. They provide pathways, again, for clear guidance on eligibility, enrollment services, and helping families understand the system that we have to navigate in order to find appropriate care. They communicate and report the ECE program information, trends, and community resources for CRE, and support early care and education professionals' engagement and participation in CRE activities. So that's our three focus areas, being community, family, and providers. And we can move to the next slide, please. So CCA of Law has organized the state into 6 regions, each served by a dedicated family access manager. This structure, allows FAMs to be embedded in their communities, build deep local knowledge, and develop trusted relationships with partners and families specific to their area. The 6 regions reflect Washington's geographic and demographic diversity, from urban King Pierce counties to rural Eastern Washington to the remote parts of the Olympic Peninsula. And this map illustrates our statewide reach and the distributed kind of community embedded nature of our work. Our approach to this work is designed to be responsive to by region rather than applying a one-size-fits-all kind of statewide approach. In the next slide, we can put names to faces of those 6 regions. So next slide, please. As our FAM team brings together 6 experienced professionals hosted by regional partner organizations with deep roots in their communities. Our FAM positions are approximately 2 years old, with several team members having joined us within the last year. The team brings a mix of established regional knowledge and fresh perspectives, all grounded in the communities that they serve. Each FAM host organization reflects intentional regional partnership with Catholic Charities of Central Washington, community-minded enterprises, Bright Spark Early Learning Services, Opportunity Council, Child Care Action Council, and ESD 112, each bringing existing community relationships and infrastructure that strengthens the FAM's reach. Before we move on, I'd love for our FAMs to introduce themselves if they're in the room or on the call today. If you are one of our family access managers or coordinators, please go ahead and unmute and raise your hand, share your name, your host, your region, and your host organization. Karina.
Morning. Good morning. My name's Karina McIntyre. I represent Southwest Washington based out of ESD 112.
Pablo.
Good morning. My name is Pablo Cohen, and I am the Family Access Program Manager for the King Piers region. And I am with Bright Spark Early Learning Services.
Brandy.
Good morning. I'm Brandy Keon. I'm with Community Minded Enterprises, and I work across Eastern Washington.
Thank you so much. I think that is those are the folks that were able to make the meeting today. Yeah, we just want to say for those of us who couldn't, you'll see we'll be able to provide contact information on our website. So that covers our regional family access manager kind of work across the state, our people, the regions, and our 3 focus areas that help guide our work. With that, I'm going to hand it off to Michelle and Diana.
Thanks, Gracie. Appreciate it. And as you hopefully have heard the theme so far, this is not a one-stop shop for this work. It really is a statewide initiative as we support the mixed delivery system. And as Rob shared, that's anything from licensed and certified programs to TK to Head Start, ECAP, tribal programs, FFN, right? We're really thinking about the whole early care and education system. As we're looking for those options of care, Michelle and I are going to share about 2 different resources that are available. So I'm going to share a little bit more about Child Care Check, and then I'm going to tap in Michelle to share more about Child Care Finder. So Child Care Check has been around, I don't know, for a while, to say the least. But it's really a tool that can be used by families to search for quality childcare. This also allows parents and families and others to get information about that individual program, including licensing compliance information and any findings such that is found at the site. One of the key differences between Child Care Check and Child Care Finder is that Child Care Check is managed by DCYF. This is a system that is connected to Walk Compass that is used with our programs and our licensing division. And then we have federal requirements because we do receive CCDF funding. And so in one of those things is we have to have a platform like Child Care Check that has the information that it does. So it's not something that can go away. So please keep that in mind. And so I'm going to pause and I'm going to hand it over to Michelle to provide an overview of Child Care Finder.
Thank you, Diana. Excuse me. My name is Michelle Nelson, and I am the Director of Family and Community Engagement at Child Care Aware of Washington. Hello, everyone. And I wanted to let you know that Child Care Finder is an enhanced platform for CCA of WA's already existing child care search referral online program. So it's a new platform, and you'll get to see the demo for it, but this service has existed for providers and families for decades. And I'll put the existing link in the chat, and I would venture to guess that many of you are included in the current referral system. And so Child Care Check and CCA of WA's online search referral tool for families, they've both existed for a very long time and have been complementary. So families can check different types of information depending on which system they go to. Child Care Finder it's twofold. It is a free marketing tool for providers. And when you see the demo, Joanna will explain some of the enhanced features. that Child Care Finder has that don't exist in our current referral system. And for families, it provides them information about all of the care options that might be in their area that we have in the database, and we'll be adding more in coordination with the CRE partners that you've heard from today as time goes. And we do not prioritize or refer one over the other. It's really based on family need. And then CCA of WA's Family Center is the statewide toll-free call center where families can find more support, subsidy assistance, and those types of things to help if they need more help than the online search. So I hope that gives you a little bit of a snapshot, and I like to leave as much time as possible for the demo because I think then you'll be able to see what some of the features are.
We also have some
Diana,
good
did you
questions.
have-
We also have some good questions in the chat too, so I want to make sure that we have enough time for that before the break as well. So,
Okay. Yeah, and I'm just going to give one quick plug before Joanna shares, and that is the majority of the remaining presentation. So we'll watch the time, David. As Michelle mentioned, there's a lot of connections from Child Care Finder with DCYF, right? The system feeds into what we have in our system. So that's how they connect, and then Child Care Connect or childcare check, all these C words is directly connected to WA Compass because it is a DCYF tool. But in order to meet CCDF compliance, we need both. They really do support one another, as CCDF does require us to have what is deemed a consumer-friendly and easy accessible website. And while improvements have been made to Childcare Check over the years, this is where Childcare Finder really comes into play and fills those gaps that are missed in Childcare Check. But again, these are both just great tools that can be used for different reasons, but also really they're working towards helping families find the information they need when they're looking for early care and education. So with that, I will stop talking and hand it over to Joanna.
Hello, everyone. Thank you for having me. My name is Joanna Cobb. I'm on the data and evaluation team at Child Care Aware of Washington with Michelle and Gracie. So what I'm going to do is share my screen and show you all the experience and the site of Child Care Finder from the perspective essentially of a family who is searching for care using this tool. Okay, so this will be a publicly available website. This is the landing page where anyone can come. Hopefully they would find the site if they're looking for childcare near them from a Google search, from a trusted source like a provider or another service provider. And just quickly scrolling down the screen here, you can see that we've put front and center some opportunities for families to learn more about the care that's available to them. So this will be a page on our website to learn more about, as Diana, I believe, described, what are all these different kinds of care options that I'm seeing in this search? What is Head Start? What is ECAP? And here we're also going to hopefully funnel families who need additional support into that call center to be able to receive higher touch navigation for people who have those specific needs. So that's just a quick kind of highlight of what that landing page includes. The other thing I'll highlight is that this is fully translatable into these 7 languages right here on the landing page for anyone to fully translate, which is really exciting. So let's go ahead and do a quick search for childcare. Here's something that's really cool is that people can search along the commute. So they can put in their home address and their work address and only find care that's on the way, right? So they don't have to look in a completely different direction. That's a nice feature. Then they'll add in their children who they're looking for care for. Let me zoom in a little bit just in case. So here, obviously, people don't need to put in the exact birth dates of their children, but this helps us know what the age of the child will be when they're needing care. So families might search for care out into the future, right? Maybe they need care starting in September, and then we can know the age of that child at that time. They can select public transportation. And if there's time, I think there will be, I'll show you all what that looks like. That's a really cool feature that we're able to offer, but it'll default to driving and then give families an estimate amount of time, drive time between their search address and the care. And then they can search if they want to and they need to for only providers that offer these specific financial assistance programs, including subsidy. So if a family has already applied for Working Connections, let's say, and they know that they need someone who is willing to offer that or, serve a child using that subsidy program, then they can filter their search to only view those providers. And lastly, here's a program season filter, right? So those are all optional filters that the family can use. And as we run our search here, you'll see kind of the experience for the family. So it'll come up with these listings, and these are all, this is a real search that we're running here, and these are providers that have opted in to appear in these search results for families, right? To say, I would like to be in these referral searches. Providers are able to say and opt in or out of showing their exact street address, right? But they can still appear in search with just the zip code, and still families can know about where they are. So that's how that'll appear for a family, is these bigger circles to know where care is without needing to know the exact street address. And then families can also add more filters here. So you can see there's this filters button here, right? This is, again, optional, but this is something that's really new, a new feature compared to, as Michelle was mentioning, our online search that we previously had. Is we heard from our community engagement and our evaluation work that families want optional control, right? They want to be able to search for the specific care that's right for them. And so when I click on this filters button, you can see that families are able to search for some really specific things. So families can say, I need care just on these days in these specific times. So here's how they can change the times, right? Of maybe they need care from 6 to 6 p.m. on these days, and then only see providers that have indicated that they offer care during those hours. Part-time or full-time, program season. Again, these are all optional filters, right? By type of care. And here's where we do have the providers that'll be included in this search are the licensed and certified care, Head Start programs, ECAP programs, and more will be added in the future, but that's the base set. And I'm not gonna go through all of them, I'm just gonna scroll down and you'll really see here all these different options that families can engage with. So they can say, I need 24-hour care. They could say a specific curriculum is something that they value. These program values, special needs services, and all of these filters are things that providers report themselves as part of this tool. Like Michelle said, a free marketing tool, right? So this is kind of an opportunity for families to engage directly with providers, right? To say, this is what I want and I'm interested in, and providers to say back, here's what I offer. So as an example here, we're just going to click view more information to see a full profile, just kind of how the experience feels looking at a provider. And as we scroll down, you can see that the family is able to see whether or not there are openings or vacancies, open slots, whatever, in certain age groups. So they can't see the total number of openings, but they can see whether or not they should expect that there's an open slot right now in certain age groups. And we can see all this information about the provider's profile, right? All of these kind of highlights of whether transportation is available, these special needs services that they offer. The family can navigate this. And I hope you're all thinking, and what I think when I look at this, is that this is just really welcoming and inviting. It's user-friendly, right? The experience of scrolling around the map and scrolling through these profiles is supportive of families getting that big picture view, that holistic view of what options are available to them, and then going through that process of narrowing it down so they can then go through and contact the providers, right? And something that the providers are able to report on their profile is, what are the steps that the family needs to take in order to enroll their child there? So is there a wait list? They can link to their specific website. Are there certain eligibility criteria? All of that can be included here within the profile. Okay, so that's really the highlight. That's the experience of Childcare Finder. You can see that people can scroll down. The last thing I'll say is that if families want to, when they're using this tool, they can save a list of providers to come back later and revisit. And in order to do that, they would create an account. So it's, oh, I'm already logged in, it seems, because I've done this before. Okay, but if you're not, then maybe I'll just actually sign out quickly. And this is another thing too about Childcare Finder is it will remember you if you're on the same device, which is really helpful. So you don't have to be logging in all the time, right? But I'm just going to quickly get back to that page. And if families want to save that list and come back and remember what they had looked at previously, then they'll be given the option to put in their first and last name and just their email. That's all that's needed. And then they'll be able to come back like I just did, like you saw, and see those lists of their providers that they had previously set up. So I'm going to click back here. And then you can download a list. The families can download a list and get a PDF document of these providers that they want to call back. And again, you can see this translation up here. Okay, and looking at the time, I'm going to wrap up the last thing, and this really is the last thing, I promise, that I'll show you is this public transportation option, just because I think it's really cool. So if the family wants to choose public transportation, and this is something that the Swellens, the child welfare navigators, had mentioned that they do frequently is they have to look up these bus lines, right? And for their clients, for their families that they're working with, that this would be a tool that they use a lot. So if I select that I'm using public transportation, and then I select one of these providers that I've searched for, then the map will automatically show me the bus line that gets me from the address that I've entered and that provider. And so then it'll give me an estimated total travel time based on the address, the bus line that I'm using. Some of them, if there's two, let's see if maybe if I just pick one farther away here. Yeah, if there's two bus lines, it'll show you, take the 5 and then you'll transfer here to the 331 and total it'll be an hour of travel time. How cool. So at a glance, you can kind of make that plan if that's what you need to do. Okay, so that's a brief demo. And just to clarify one last time that this experience that you're seeing, it's based on the information that is opted in, providers opt in to appear in this search, right? So initially, the information of what providers exist, that comes from our partnership with DCYF, as Diana had explained, that's that data source. And then providers, they enter in their optional information of the photos they can add, information about their staff members, those openings, that's all information that's entered in by providers for families to see.
Thank you, Joanna. And then I think that you're wrapping up with the question that's in there and really understanding where that information is coming from DCYF, and that's coming from the dashboards that's already public knowledge, and how that is getting to CCA of Law, and how that some of you may have see your profiles in there, some information about yourself. It's already from those dashboards from DCYF, and then you get you have the opportunity to opt in and actually make that more available and what you want to add to that messaging and really be able to put in what you want to be filtered per your program. Is there any other questions for Joanna, specifically in Childcare Finder and at this time?
Yeah, my hope is that I can just kind of run through the questions in order of how they came. And if everybody's able to just hold on for the next 11 minutes, then we might be able to kind of get through those if that works.
Yeah, David, some of these questions we'll have to take back to our team and answer together as a
totally,
team and then send
totally
that out.
Good. Yep.
So, and that's why I wanted to initiate the initial conversation about Joanna specific, because she won't be there for that space.
Okay.
If it's okay, I could answer a couple of these questions that I'm seeing. Is that okay?
Yeah, if you want to just take the ones that you think are yours, Joanna, that would be good. And then I'll do the ones that are not that after.
Okay. So yes, I see a question here from Julie that are there default things for each providers? I've opted in, but there's a lot of info on my profile. That's a great question. So like Michelle outlined, right, the Child Care Aware of Washington referral search program has existed for many years. And so as long as this referral system has existed in different forms, Child Care Aware of Washington, the Early Achievers coaches, we have reached out to providers when they become licensed or whenever we reach out to providers, gather this information, and ask providers to opt in, right? So that information that may have previously been entered through, it used to be a provider update form, maybe through your coach and discussion with your coach, it could be a variety of different ways, will be populated into the Child Care Finder profile. And then providers can go in and change that information, remove it, decide to publish or not publish their profile overall. So those things may be in there. If you're seeing, let's say, a description, you're thinking, I didn't do that to, in the last couple weeks, where did that come from? That might have been where that came from. The only other information that would be default is just like the address of the site. That detailed information about the program isn't populated in any other way other than by the provider. So I'll put in the chat the provider support email address for Child Care Finder support. So if anyone has more questions about how they should engage, about what they're seeing or experiencing with Child Care Finder, whatever the case may be, please feel free to reach out to that email inbox specifically for Child Care Finder use as a provider.
And Joanna, there was another question. Was the updated Child Care Finder tool tested with family or center providers? Would like to know what feedback was received, what was implemented, and what was excluded.
Yeah, that's a great question. So we went through a few iterations of some testing and feedback, especially as it pertains to the training materials and the communications materials that we needed to distribute with center providers and family child care providers. And we also, I'll just say, as Child Care Aware of Washington, we also work closely with those early achievers coaches to hear feedback directly from providers as well. That way. I'm sorry, I will slow down. Yes.
No, that was actually my fault. It was me reading the question. You're doing fine.
Okay, good. Yeah, so that's a great question. And again, I'll say through the provider support inbox, which let me put this in the chat now, we also have been fielding reactions, feedback, experiences of providers using the tool there during this onboarding process through Child Care Finder.
Cool, thank you. And it looks like the rest are more about childcare check. But one thing, if CCA is still on here too, there was a question about what specific things do family access managers do for providers?
Yeah, thanks. Thank you, David. I just put that in the chat. Currently, it's still a work in progress as part of the overall CRE framework. So nothing specific at this time directly for providers. So we're asking folks to stay tuned, but we're looking at our current infrastructures, given our partnerships and relationship with DCYF, the AESDs, and OSPI for additional kind of shared communications and information pathways and so forth. So stay tuned, as we'll most likely be trying to survey some providers here. So you might be contacted.
Okay, thank you.
There was a share.
Oh yeah, go ahead.
Yeah, I wanted to share that today they called me and I went in. They answer my questions and I really like it. This new has a lot of information, opportunity to write about our program, and a lot of really good enriched information that I can provide. But I really like this compared to what it was. You guys did an amazing job.
Excellent. Thank you for sharing that, Veronica.
Can I add one thing? Thank you. Also, and that reminded me something I could share is that our communications about Child Care Finder have been primarily email through coaches and newsletters when we can. And so we have started calling providers who we haven't been able to reach through email before. So it sounds like we called you. Amazing. If you haven't checked your email, if you're interested, please do so. If you don't have access to email or don't see anything, we may call you, but we also have that email in the chat.
Joanna, I know, and you guys are obviously connected to the coaches. I would say another pathway, and I don't know if licensing is here too, but actually not everyone obviously has coaches, because not everyone is involved with early achievers and things like that as well. So I just it would be helpful, I think, if the actual licensors during their monitoring visits could also bring this up to people if they have not had the opportunity to complete their finder. That's a way to cover everyone. I know when that email first came out, I actually reached out to you guys because it did have a little bit of a spam look to it, and I wanted to make sure it was real because of what's already available on Child Care Check. And so before I had reached out to all of my programs to say do this, it was kind of a double check to see whether or not it was legitimate. Just the way that people get emails now, the amount of them can be pretty overwhelming. And so just that face-to-face, one-on-one communication rather than big drops sometimes can reach people in different ways too, via a licensor or an individual email rather than it just being kind of a big drop. So anyway, just my thought on that.
I appreciate that, David. Great minds think alike because that is a conversation we've already had too. And as we think about ECAP, how do we work with the contractors, subcontractors, directors? So
Yeah.
we are looking at different avenues of those conversations, like what existing meetings are happening. So the
Cool.
CCA team has been really working hard on getting the word out about this resource.
No, that's awesome. That's good. I'm going to go through and audit all of mine, and whoever hasn't done it yet they'll get an email from me. So that'll be great. One of the questions at the top at the beginning was, does the saturation study released recently belong to CRE? Is there an effort to verify the data? I don't know if that's somebody on this call right now that can
So the
answer that.
saturation study is connected to our ECAP team. However, we do look at that information and use it as a resource, as ECAP is part of coordinated recruitment and enrollment. And so it is one of those things that we're looking at. And again, it's something that we continue to refine in how can we use the saturation study, recognizing that our early care and education landscape has evolved over the years as well.
Cool. And then in the CRE process overall, is availability of care being addressed? It seems there are more children needing care than spots available. Are you seeing this?
So we are seeing this. I wouldn't say it's necessarily connected to the CRE initiative, but it is an initiative that all agencies are passionate about. And I would say this is connected to the Access and Living Wage Plan that we've shared here before. And that's where we're focusing on increasing access. And we're just wrapping up a facilities project because in order to increase access, we need the facilities for that as well as the workforce. And I know there's teams working on the workforce side too.
Thank you, Diana, for that. And then a question, what is required by CCDF and what does DCYF voluntarily share with the public in Child Care Check?
That is a great question that I am going to refer to Matt Judge to respond to in the feedback loops, just so I don't misspeak.
Perfect. And I know I saw the note about the first time forgiveness in there as well, so we'll wrap those up together for the feedback loop to get that particular answer. And I think that covered the questions. Unless somebody has anything else they'd like to provide, I really appreciate everybody that had joined for this particular conversation. Joanna, thank you so much for going through the child care finder as well for people to be able to see that tool. I think it's really helpful for people to see that, to know how that can positively impact their program as well. So thank you all for joining for this for this session, doing this presentation. It was wonderful to meet so many of the people that are doing the coordinated recruiting and enrollment throughout the state. All right,
Thanks for
Jessica's
having
gonna
us.
absolutely. Thanks for being with us the last couple hours, Diana, too.
I wanted to share, I love that that we're able to upload photos, video tours. I think that is excellent.
Yep, absolutely. Okay, so a couple things. We have the Mentimeter for this presentation. as a part of our feedback loop. What we're going to do next is we're going to take a very short 15-minute break. And then we have two really good topics after our 15-minute break. So the Zoom will stay active, and you can just mute and turn off your photo, and then we'll be back again in 15 minutes. The first presentation after the break will be the staff qualifications work group presentation. And then the second presentation will be about how the DCYF coming to talk and get feedback about their strategic planning. So please stay on and join us after our 15-minute break. We will see you all at 12:15.
Okay, we are ready to come back. We've got our next presentation. It's the staff qualifications work group presentation. So we've got Brett Skinner, who is the Child Care Policy Manager with Licensing Division, and Susan Endersby, the Staff Qualifications Coordinator. They're going to provide an update on the Staff Qualifications Work Group as part of House Bill 1648. DCYF was tasked with establishing a staff qualifications work group to help improve qualification requirements and the verification process. Members will receive an update on the establishment of this work group and the next steps. Welcome.
Hi, thank you so much. I'm Susie Endersby, sorry, changed my name recently. Staff Qualifications Coordinator with the Early Learning Division, and we are going to present the updates from the last couple of meetings that we've had with our work group. If you could go to next slide. Thank you. Today we're looking to gather feedback really around clarification of recommendations, potential challenges or barriers around implementation, and if there are identifiable gaps or unintended impacts. Across several topics, the recommendation for clearer navigation came up. So today we're going to share the progress, provide an overview of the proposed recommendations that we reviewed with the work group on Monday, hopefully gather some feedback and questions from this group. And then the proposed recommendations are listed on the right-hand side. There is the staff qualifications requirements, education access, verification, and navigation, the experience pathway, community-based pathway, which would be PACE, and out-of-state training. Next slide, please. So the House Bill 1648 Staff Qualifications Work Group has been meeting monthly to develop recommendations related to staff qualification pathways and implementation considerations. In May, the work group focused on key areas, including education access, verification, and training pathways. During the June and July meetings, the work group continued reviewing and refining recommendation areas, specifically around how experience will be counted. The July meeting focused on final discussions and recommendations that will be included in the work group's final report. Additional details about recommendations and next steps will be shared as the work group's final report moves forward. We would like to acknowledge that the feedback we received from the work group members on Monday included the core concept or the spirit of proposed recommendations were thoroughly discussed.
Cerré la puerta de Valeria, que dejó.
Work group members' feedback identified implementation questions that DCYF will continue to work through. And some of the examples of what that looks like are how substitute staff fit into the recommendations and the role of licensed family home providers and where they are fitting into the recommendations on experience. And then explicitly naming school age providers in our recommendations. Next slide. So this slide, just to give an overview of the recommendation process. We have work group discussions monthly, and then our work group members and ourselves provide the advisory feedback to the different groups, including provider supports, ELAC, and IPEL. We've drafted recommendations based on discussions within the work group. And then those recommendations were reviewed by the executive steering committee, and they come back to the work group for a vote. And then final recommendations are decided, and the legislative report will be drafted. Next slide, please. So work group recommendations around the staff qualification requirements include improving clarity and navigation of staff qualification requirements by developing the clear, accessible resources, really looking at accessibility, language access, and the clear language for everyone to be able to understand. Creating additional tools to help professionals understand the pathways and plan their next steps, which may be decision trees, flowcharts, crosswalks between pathways, connecting professionals to education, training, and career support resources. In addition to that, there are some future rulemaking considerations that the work group requested, exploring long-term approaches to staff qualification requirements, and reviewing the role of experience, competencies, and equivalencies. Things that came up were starting the rulemaking process as soon as possible after the report is submitted, using stronger language to identify what the recommendations are speaking to, and then moving out of the scope from discussions and recommendations to implementation. The work group identified that information about staff qualification requirements and available pathways can be very difficult to navigate. So a key recommendation is to improve the clarity and access and support for ECE professionals as they work toward meeting requirements. Recommendations really included developing resources in multiple languages, using decision trees to help individuals understand their current education and training, and then connecting those to available education and career support resources. And then the work group also identified those future considerations that would require a negotiated rulemaking process. Especially exploring the long-term role of experience-based competency, ensuring qualifications reflect the knowledge and skills needed for each role, and review the career progression pathways. Next slide. So education, access, verification, and navigation. Again, navigation came up across all recommendations, really looking at accessibility, considerations around how to include licensors for technical assistance, and narrowing down the pathways to inform information. So it feels very overwhelming to have to navigate Walk Compass, Merit, the DCYF website, and our career planning portal. So we're going to be working to simplify the navigation, what in-person support looks like, and establishing more visible timelines for education verification. And just double checking on this one. I believe that covers this slide, so we can move on to the next one. This slide is just an overview around the experience pathway. So the House Bill 1648 allows eligible early childhood education professionals to meet staff qualifications through experience, requires 5 years of cumulative experience by August 1st, 2030, which means breaks in service would not start that 5 years over. Cumulative means that you can come and go as long as you accumulate to the 5 years with by the August 1st, 2030 date. And experience will be calculated through merit employment records. The included roles are those requiring the initial, short, and state certificate, and we will also be including school age roles. Implementation considerations were to improve access to out-of-state, tribal, and military experience verification, strengthen consistency in how experience is applied across roles, and the experience-based qualification may also satisfy hiring education requirements when met. And I'm going to pass it on to Brett.
Thank you, Susie. My name is Brett Skinner. I'm the Child Care Policy Program Manager. Quickly, I want to shout out Susie for getting the Wear Pink for presenting memo. Not planned, but amazing. I also want to shout out everybody who participated in the work group. We had the meeting on Monday in person. And we spent a lot of time in there, and it was a lot to cover. And we're kind of still processing a lot of the information that came in, a lot of the conversations that we had around the recommendations, potential implementation. Um, and there's just a lot of nuance with this work. And I just really want to commend everybody for leaning in. Things weren't always perfectly lined. You know, when we have that many people together talking about things, there's going to be differences, but everybody was respectful and we were able to make a lot of progress. But also at the same time, we're still making sure that we process that information and we get it compiled in the way that it was intended. So, um, here on the slide, we have the proposed recommendation for experience-based pathway. So allow the experience to count across roles with similar responsibilities within two role groupings. So we kind of had the teaching roles with the center, family home, and school age, with assistant teacher, lead teacher, family home owner, and licensee. And then we sort of had this different category, which had a different type of leadership roles, which are center program supervisor, center assistant director, center director, program director, and site director. And a lot of that is some of the alignment that kind of exists within the rules already. And as Susie mentioned, we wanted to make sure that school age gets explicitly named. It wasn't named in the bill. We have some different work we need to do in terms of the implementation, making sure that it's clear. She mentioned navigation, and wanting to make sure that it's easier for people to follow and they understand what they need to do to be in compliance. We also talked about concerns with some of the implementation language, making it more clear, making there being more teeth to what was happening with these. And then we also talked about as we work through this, there are going to be some deadlines in terms of as people potentially move up in roles or switch from one category to another category. Um, there are some potential deadlines that we want to make sure that we're communicating out to the field so that if people are wanting to make that switch, they would have that time to still come in and meet these experience requirements if you did happen to switch roles. Um, but there was a lot of fantastic feedback and conversation. Um, there was a lot of conversation about the amount of work that family home providers do and trying to navigate the differences between a family home provider versus, say, a program director, and how to make sure that we're valuing those two roles for what they do. And so continuing to look at that. If we want to go to the next slide, So this lays out a little bit more of the detail. So for center-based leadership roles, allow up to 2 of the 5 years to be experienced as a lead teacher or licensed family home owner or licensee. Require the 3 remaining years to be a center-based leadership role. This recommendation aligns with current hiring requirements, which recognize 2 years of teaching experience for center leadership roles. So, for instance, if we currently, if you had a lead teacher that you wanted to move into one of those leadership roles, they could basically move into one of those roles in the next year and still be able to meet their requirements through experience because they would be able to get the 3 years in the leadership role. And so that was a part of the negotiations and a part of the conversation in terms of how we could work through this at this time with this bill. Um, and so there would be some instances where some individuals wouldn't meet that requirement if they did say change right before 2030. If you switch to a director right before 2030, then you would have some more work to do with those. So um, we that's a part of what we wanted to make very clear to the field that we communicate that out so that if you have anyone that you're thinking about moving into one of those roles, you could put that preparation in place or put those plans in place to potentially do that. If you want to go to the next slide. So there was a lot of conversation about pace, and how to improve and work with pace. There was also conversation about doing something different than pace. So we wanted to address the short-term improvements related to access and awareness, alignment with other pathways, the type of content and delivery so that it's matching people using it and that it's culturally relevant. And then it was important to the work group to also reevaluate future expansion based on implementation data and available resources. So gathering a lot more information on how it's working, is it satisfying the need? Are people getting what they need out of this? Or do we need to look at creating drastically different pathways? A part of the conversation is that there's a lot of investment already in pace. There are a lot of people that are already within contracts and a lot of things being built and improved already. So that is a part of the conversation, but the work group really wants to make sure that we can continue this conversation and get more data to work along with it. If we want to go to the next slide. So this is around out-of-state training, and the recommendation is to improve recognition of out-of-state training by simplifying the process and reducing administrative burden. There are a lot of DCYF system updates that were initiated June 1 of 2026. Simplified application for non-state approved trainings and conferences, reduced reflection questions to 1, updated alignment with current ECE and school age competencies, and a new document upload option to streamline submission. The work group also wanted to make sure that we were connecting with other states about childcare basics for alignment, and looking at equity and accessibility for delivery. And I was doing a not great job of following what was happening in the chat. I think that there are some helpful links being applied. But sorry, if we go to the next slide, we basically now want to make sure that we're gathering feedback. when I was first talking, I was trying to establish that we did just convene in the work group on Monday, and so we are really trying to make sure that we unpack those conversations and make sure that we get those thoughts fully written out into what the recommendations are going to be. So there's going to be more to come in terms of what the final writing looks like. Um, but we wanted to know what additional clarification you all would like to hear. What implementation challenges or barriers do you anticipate? And where do you see any gaps or unintended impacts? So we want to just take some time to kind of go into that.
Brett, I'm going to run through the chat real quick. When we
Awesome.
hire someone, how does the hiring manager know how many years the applicant has already accumulated, maybe in other early learning centers for the experience pathway?
That's a really good question, Julie, because my understanding is that um, supervisors can only see the current employment history. And so
Not
it
the
would be
history.
sorry, well, I mean, if they were hired 20 years ago in the same center, you
No,
don't see that. You don't see the start date of when they were hired in your center.
no.
But center directors have to, oh, what's the word? It
I
starts with
see when I log in, I see my list of current employees and the date that
uh-huh.
they started with me
Yeah, yeah,
currently.
yeah, yes. So that's what I'm sorry. That's what I was trying to say is that you can see their current employment
Right.
from their start date with you.
Yes.
Yes.
So
It
if I
will,
hire someone new and they say, I've been working at a place for 4 years and I'm working towards the experience waiver, or I'm wanting to use that option, how would I know that? How would I verify that?
the licensor can help to verify that. Uh, they're able to see the history, the previous jobs that they've held, but also um, merit will be updated with the enhancement to show that they meet the qualifications. And you can always reach out to the merit system navigation team or ask the employee themselves if they can share what their previous experience was or their previous job roles.
Yeah, it'd be nice if it said that if merit showed that they were in work on the experience pathway and they've got 3 years or something. Reaching out to a licensor with something like that, um,
Yeah.
it should all show up in merit. Okay, so Janelle asked, is any of the previous work from the micro-credential program being used or considered with this new group?
No, the micro-credential pathway was not pursued, and the those that could have qualified to use the micro-credential pathway, they all qualify from the point that the micro-credential pathway was removed. Everybody previously to that would qualify with experience.
Okay, and then Lois commented there was also a conversation about sharing that we did not come to a conclusion. There were three options. The room was not rah pace. So
Exactly. Yes.
the three options being, can you go back to
Sure.
that?
Well, the first option that was presented to the work group was the short-term and long-term updates that could be made to PACE and considered for PACE. The second option would be within the report to identify that there was not consensus among the work group members to make a recommendation. And the third option was to say that, Brett, was the third option to say completely that they didn't want to continue with PACE?
Yeah, it was yeah, like we don't want to, there's no consensus. We can't agree. Um was definitely one of them. Kind of make improvements, do what we can, or we think it should be discontinued. And I mean, it was kind of like a blunt breakdown, and then there was lots of conversation. And Lois, to your point about fully weighing in, I think we wanted to give as much information as we had to this group because we're meeting. Um, and so I agree there can't, we can wait and make sure that we get it f fully clearly written. But we did want to offer the opportunity for people to hear this and process this and provide feedback too in the interim.
Okay, I had asked about how many providers are on the work group, and I can see the roster online, but it doesn't always indicate if they're a family home or a center.
Wait.
Maybe that's something that could be updated.
I'm sorry, Julie, before we move from that topic, and I'm not a co-chair, but Dave had his hand up, and I also want to piggyback on what Brett just said. But Dave's hand was up first.
Lois, yours is more relevant to the topic that was current, so carry on.
Okay, thank you so much. So here's my take on that. There were so many. So just for folk know, we rate it on a scale of 1 to 5, with 5 being we definitely agree, 3 going, yes, I agree, 3 being I can live with it, and then 2 and 1. And the reason, and 2 being, no, I don't like it. And here's my reason why. And 1, just, I basically hate this. And so I just wanted to share that so folk have an idea. There were way more 3s in that room on Monday. Um, Quite a few 2s. There was, I think the data part is the one that received the most 4s. I don't know if we had any 5s on anything at all. There might have been a few, but I wasn't keeping track. And I share this to say that there were so many language amendments that people were adding, and you guys DCYF staff took great notes on that. And I just feel that sharing this out now without those amendments being incorporated does not fully reflect the voice, the community voice that came out of our work on Monday.
I agree.
And so I would ask the co-chairs, since, it would be up to you. And I know Susie and Brett, I really appreciate all the work you guys have done into this. I know that you have put into this, excuse me. And I also know that you are slated on the agenda, but I also really feel that without that added language, provider supports will not be able to give you the full feedback that this group should be able to do. And I know we have a process, I know we have a timeline, I know you are required to come and report out, but it just seems premature.
Thank you, Lois.
Seems fair.
Dave, you want to jump in?
Yeah, and thank you, Lois, for that too. My question, I think this was one of the barriers that I saw. One of the things to make good decisions about each individual staff member and their potential pathways forward is to be able to get better turnaround on education after it's submitted in their merit account. Has there been discussion about cracking that particular nut? Because it still lags significantly beyond what the original kind of January, we're going to be all caught up time frame was stated.
Yes, there has been a great deal of conversation around that, and DCAYF is working to figure out best pathways and to helping to reduce the length of time and also to provide clearer communication about where someone's at in the process so that and I'm kind of, I know Brett's used the pizza timer before, but one of the concerns is that providers receive an email once their education is under review, but a supervisor does not receive that same information, so they might not be aware of where they're at in the process. And so we're discussing how Supervisors could be included on the communication about where someone's at in the process and what the time frame looks like. In addition, it is our something that everyone is in agreement that we need to figure out how to shorten the wait time and get things moving quicker. Julia, I do want to follow up on the PACE conversation that there was not consensus in the work group, and DCYF is moving forward with PACE for now. We have several providers who have selected this option, and many who are currently in process of completing PACE. And so that's why on the slides we tried to include that it was more of a discussion and not a recommendation, that we will continue to make adjustments during this contract year. Contracts have already been completed for this year. And in the meantime, we'll be making as many updates as possible around communication, sending out more information about when PACE offerings are available. We've worked with contractors to increase the number of opportunities for PACE. And during that time, we'll also be gathering as much data as we can within certain guidelines, that we'll be working with the work group, with advisory committees around what data we want to look at and how we want to use that going forward. But it was recommended and requested by the work group that we're really looking at the data between PACE and scholarships and education, and sharing that data on a web page or on a report in some way that will help guide future discussions around PACE.
Yeah, thanks for that additional info. I think that providers have not been very aware of PACE and the equivalency waiver, whatever it's called. So it's always good to hear that there's more information coming out and more awareness, and that people are involved in it. Okay. Lois said the question is whether it's the best use of money availability. So, all right. Well, we are wrapping up this section of the meeting, and thank you to our presenters, Brett and Susie, for being here and all the questions. Jessica will put the Menti back up so that we can share feedback on this presentation. Make sure to put your questions as well as your comments in there, and we'll move on to the next section. Dave?
Susie and Brett, did you have any final words? I just saw you put one more slide up there, so I didn't want to.
Oh, sorry. Yeah, just incorporate the feedback that we've mentioned a couple times. The report, the final ledge required report is due by December. And so there are some things that we want to make sure that we're going through in terms of making sure we get it drafted correctly, that people have an opportunity to provide some feedback, and that it goes through the different steps. So kind of just making sure that it's clear we're on the same page, and that it will be continue to move forward from here.
All right, thank you guys for being here. And Jessica did put the link to the Menti for this presentation in the chat. So if you have additional questions or feedback, please provide it in that space. All right, our last presentation of the day is going to be about the strategic planning session with this group. So we want to welcome Kendra Hodgkin, Program Management Administrator, and John Tuttle Gates, Director of Office of Strategic Initiatives and Collaboration, who will engage provider supports in feedback gathering session to advise DCYF strategic planning. Currently, DCYF is creating the 27 through 31 strategic plan and wants input from advisory groups and lived experts. Kendra and John will talk about what the plan will cover and hear from members about what success means to the Provider Supports Subcommittee. So Kendra and John, thank you for being here, and I will let you take it away. And just a reminder, one more time, that we do have our interpreters with us, so just watch your spoken cadence. Thank you.
Thank you very much for that great introduction. And thank you all for letting us use some of your valuable time to garner some feedback around our strategic planning and our strategic plan as we move forward. So my name is John Tuttle Gates. I wanted to talk a little bit today about what we're hoping our time together today will be able to kind of achieve. The first one is that we'd really like for you to be aware of our process and the purpose behind that and why we're doing strategic planning, what steps we have already taken, what steps may be coming up in the future for your additional input as we go through this process. Then one of the themes that has come up from a lot of our areas has been about improving and building really important partnerships throughout our work. And so today we're really wanting to get your insights and thoughts around what success looks like, really connected to our partnership with you, our partnerships in the community, and our partnerships with the folks that we serve. I wanted to take just a moment to talk about when DCYF talks about strategic planning, this is kind of our key ideas of what is a strategic plan. Really, the strategic plan explains what we want to achieve in the next 5 years and what is most central to our work as we do that work over the next 5 years. It helps leaders make decisions and use time, money, and staff wisely to meet future goals. And then, because we are a public agency, a strategic plan can help build trust by helping people understand how we are making decisions and how we are measuring our progress as we move forward. Excuse me. We've also wanted to identify some of our internal thinking about why it is important for children, youth, and families. We're really hoping that our strategic plan can help us focus on the important needs like child safety and well-being, education access, youth homelessness, and family support. It improves the teamwork across programs. We're really working on a concerted effort to work across programs in a holistic way when we're serving our clients, and having a cohesive strategic plan can really improve that as we all get into the same lane and moving in the same direction. It also hopefully will help divisions work together so that families don't fall through the cracks, and also the families receive all of the services that are available to them in a timely and coordinated manner. It helps us focus attention and resources on the needs that matter most to our communities. And it's going to create accountability by showing progress being made and where more work is needed. Now I'd like to talk a little bit about the sort of phases and schedules of the strategic plan that we have moved through and are going to in our next couple of months. So this whole process started in October of last year. A cross-divisional group from across the agency got together, and we did a comprehensive review of our existing documents, reports from various areas that we already have, our current strategic plan, the Blue Ribbon Commission that initiated DCYF, our current outcomes and metrics that we're currently working on, as well as division priorities and requests from the legislature. All of that was to give us a good grounding in where we're at right now, what we've already tried to accomplish, what we need to build on, and what we need to stop doing. And then we started an early engagement phase, and this was an internal engagement phase with just DCYF staff, and it was virtual. We held quite a few sessions and ended up getting to connect with over 600 staff in those initial phases. And those initial phases or engagements, excuse me, were very broad. They were getting a sort of temperature check from the most broad that we could in ways of what do you want DCOF to be working on? Where should we be focusing? What really excites you about your work? Where have you found success? Um, we then took all of that information, and a group of folks analyzed every comment, every piece of feedback that we received, and we developed 5 key areas that were kind of key themes that kept coming over and over and over again in those early engagement sessions. We then took those 5 key themes and we participated in over 70 in-person staff feedback sessions and idea generations based on those themes, talking about how do you see these themes work out in your areas right now? What resonates well with you? What would success look like for you? We also, in that engagement phase 2, connected with tribal partners and tribal nations from across the state in about 6 different sessions in various formats, kind of exploring those same questions so that as we were developing our thinking, we were doing so with our tribal nations in mind as partners in that thinking. We also held 4 sessions with folks with lived experiences, again, trying to draw out how these things showed up in their lives, what they found success, what were their challenges, what would they like to see differently. All of that information is being analyzed, combined, and worked through. And then we are currently in the drafting phase, in which our executive leadership table and our other leaders are drafting the actual language of the first draft of our strategic plan. That should be ready by mid-August, maybe a little bit later in August, in which time we will start our secondary feedback session. These sessions will be a presentation of the plan, and it will be asking folks that we either connected with before or need to connect with more thoroughly. Here's what we heard. Here's what we did with what we heard. What did we miss? What did we misinterpret? What did we get right? So that we can then in this winter go back and take that feedback, revise our original draft, and finalize our draft in January. At which point in time, we're going to go on a 6-month, what I'm calling a PR tour, which is going sort of ensuring that everybody in our agency, all of our partners, all of our legislative connections understand what the strategic planning, what the strategic plan says, what it means, and how they can see their work fitting into it. So that is our phases of the agency strategic planning process that we have done and that we are moving into. I will also just highlight that each division will also be going through the same process. They're beginning those pieces as we speak. And so for early learning specifically, there will be another opportunity for you to provide input into that strategic plan that is specifically around early learning, but then also connected with our agency-wide strategic plan as well. So those are any questions so far about the phases of the agency strategic plan? Check chat real quick.
There was just one question that just came in a second ago. What are the main priorities of the plan?
Yep, thank you. So the 5 key themes that came out of, it's not on the slide deck. The 5 key themes that came out of our sessions with staff were focusing on our impact, meaning really gearing our policies, our practices, and our resources towards how do we improve the impacts that we have in the communities that we work, and how do we focus on ensuring the outcomes for those communities are at the center of our decision making. Staff safety supports and growth, which talked about how do we ensure that our staff have the right tools, skills, and abilities in order to help walk alongside our children, youth, and families as they are navigating our systems. The third is working together as one. And I touched on this a little bit before, but it's a real sense of how do we create a coordinated effort within DCYF so that as families engage with DCYF, regardless of where they came from, where they live, or how they entered DCYF, they will be able to navigate that system seamlessly and get the supports that they need in order to build the futures they define for themselves. Developing and sustaining partnerships and relationships was another key theme that came out. This was a lot of talk about improving our connections with and partnership with our tribes and tribal nations. Also being really intentional about how we show up as in partner and recognizing that sometimes DCOIF thinks they're partnering with communities in a way that is beneficial, but it is actually not partnering in that way. And where can we improve those partnerships to really reflect our intent of working alongside our communities and partners. And then the last one is building capacity and resources and managing change. And this was a lot of talk around how do we ensure that we have the right resources in the right place to really move our goals forward? And then how do we manage change in a way that is effective for those that we serve? We get a lot of changes that are externally focused on, or forced onto us. And we have not always in the past done a great job of ensuring those changes get implemented thoroughly, consistently, and well. And so those are our key topics and theme areas that we are working in right now. And again, we used those themes to gather even more input, and then we're working into the drafting pieces. Sorry, we don't have any of our specific outcomes developed yet. We're still in the drafting phase, and that's one of the things we're hoping to have your input influence as we move into that definition of we are going to reduce the number of kids, blah, 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 or we are going to increase this metric, so forth and so on. We're not there in the planning process yet. And I think, Julie, you were looking at our current strategic plan. Is that correct? Given your chat. Oh, I'm sorry. This was an example that I put together, a hypothetical example. This is not actually one of our outcomes. What we wanted to do here was we wanted to clearly define what we are thinking of as an outcome. The reason being in strategic planning language, a lot of these different terms can be used in different ways by different groups. And so we wanted to just be clear that for us, an outcome is a specific result or impact that happens because of achieving our goal. And so that's how we're identifying outcome. The purpose is to measure success and help assess whether the goals are being meted. And that was just an example. And again, these aren't specifics. These are just hypothetical examples. What we're hoping to get today, our community engagement group has developed this really fantastic, I can't remember if it's a framework or the exact word, I think it's a framework around the different types of community engagement that we engage in across the agency. And I really appreciated that framework because it's really helpful to sort of set expectations and ensure that we understand what we're trying to achieve and what we are going to be able to do with the feedback and information that you provide for us. So in this particular space, we are in the consult level of engagement, which is really about a kind of a one-time limited engagement in which we are asking for you to provide us input that we will then go back and incorporate into other spaces of input and ensure that it gets reflected, but it is not necessarily a decision-making space or a co-design space. So I just really wanted to make sure that we were on even footing as to what the intent of our conversation is today and be able to elicit feedback in that manner. So this is where the interactive portion of the conversation I'm hoping will get us started. Kendra is going to be furiously taking notes in the background to hopefully capture the feedback that you provide for us, either verbally or in the chat. We are really looking to see if we can explore some of these ideas of what a successful partnership might look like between DCYF and this group specifically, or for communities and partners more broadly. So when you think of things that are going well that we could build on in our partnership with this group and with communities, what are some strengths? What are some practices? What are some ideas that have worked well in our partnership space with this group or with our communities?
So if you guys feel free to either raise your hand and share, or if you put your questions or comments in the chat, that would also be helpful.
As folks are contemplating responses or developing their responses or typing them, we can also look at from a lens of you would be able to say, oh, DCF really understands and supports this group. I can see that. What would that look like? What behaviors would you see? What changes would there be? What improvements would you see?
So I'll answer the last or the third one. For me, what outcome would show that DCYF is meeting the needs of providers would be if the recommendations were followed from the staff qualifications work group. Our staff there's a lot of expectations, and some of them will age out, not age out, but they've got 5 years to get their education in place. If they don't qualify for the experience waiver, then they're just going to be out of early learning, even though they might be an excellent, excellent early learning person. So that's the outcome that would most meet needs for providers, in my opinion.
Thank you. Is it fair to say more broadly that this group would see the recommendations more thoroughly enacted over time in general, or is it about this one specific?
It's about the specific work group and making sure that those that are in charge of putting them in place, accepting the recommendations, actually do. There's been a lot of work groups and committees over many years that have completed their work and then nothing happened. It's a big investment of time for the people that show up to these committees. For me, I always think about the compensation technical work group. It was a lot of work, a lot of time invested by providers, and nothing came of it. So I would hope that this work group that means so much to providers would be implemented. All of the recommendations would be implemented.
Thank you. I'm also wondering if a more robust communication loop would also be part of that solution, so that if there was some reason we couldn't implement a recommendation, those that worked on it understood the reasoning behind not being able to, or the thinking behind it. Does that resonate as well?
I don't know. I mean, we do get reasons sometimes, but again, to have a reason following a no when there's been so much investment of time and effort among these volunteer providers to um, do good work for their provider community, that's a hard pill to swallow, even with a reason.
Okay, thank you. That's helpful. Other outcomes that would show that we're meeting the needs or the needs of those that you represent or work for?
I think that over the course of the last couple of years, we have tried to do a better job of being specific, bringing topics that are actually relevant to daily impact of providers to this meeting and try to do a good job of weeding out things that should not be here because it just doesn't affect their day-to-day operations. When people are coming to this meeting, oftentimes they might even be listening to it on the phone while preparing lunch for their program or helping check in and check out, or they have it on in their office in the background, but they're, jumping in and out of the meeting based on conversations with parents or, working with teachers and kids and things like that. So I think that one thing that Julie and I have tried to do with community engagement is be very intentional about every topic and minute that people, spend at this meeting is something that will be relevant to their operation. And I think that um, we've had good conversations with DCYF about making sure that that's true and really just taking out things that wouldn't be and putting that more in a written update or a notification or something like that. So there's continued work to be done with that. And sometimes we miss. We think that something's going to be relevant and it ends up not being as much. But I think that that's been a good kind of partnership thing that we've worked through over the course of the last couple of years.
Thank you.
Have you guys created a survey to just send this out?
I believe there's a survey in the link that's going to be open through next week for folks here to be able to participate or be able to participate later on.
So who would have gotten the link?
I think it's in the chat of this meeting.
So have you guys talked about sending it out widely to providers?
We have not. We've talked about engaging with the existing networks that we have in the spaces. So that's why we're here and we're with the another provider group tomorrow.
Yeah, there's a lot of providers that care and would have a voice, would like a voice, would like to be able to say something, but they are busy cooking or they are busy covering because somebody called out sick and they're not here. Even though we've got 42 participants today, we've like there's some people that are on here in like 15 to, well, there's a lot of DCYF staff on here. There's a lot of presenters on here. The number of providers in this meeting is very small. So I would definitely try to get it out through other means just to hear from more providers.
I
Thank you.
agree, Julie. I have a WhatsApp. There's several groups out there. Many have more than me, but one of the groups I have is about 150. And I think only a handful were able to get in through the link I shared because it's hard. But I feel it's important because a lot of them, just what Julie said, hit the nail. And they want to participate, they have questions. A lot of them feel their voices aren't heard, and when there is, some stuff just falls through the crack. So yeah, I mean, it's it's powerful what she's sharing. And David.
Thank you. We'll take note of that and we'll also ensure that we highlight that for our early learning division strategic planning process as well.
John, one thing I didn't hear when you were kind of outlining the 4 or 5 general big areas of the strategic plan, and this I really feel like lives in a day-to-day provider's world, is just systems of communication.
Okay.
If you email your licensor, what is the expected response time that you should receive an answer? What is the, written timeline of the process to go through pre-licensing, through fire marshal, through licensing? Those things float quite a bit, and I think that this group has advocated in the past to be able to figure out if there was a way to create more kind of um, communicative accountability. And I just don't know if that's come up in the conversations that you have had with the different groups that you've been talking with.
Thanks. I'm sure that some have highlighted specific communication accountability with providers and licensors. We have heard more generally around robust communications in all directions to help improve clarity, to help hold accountable, and to help families navigate systems more effectively. So I think that's in line with those general themes that we have heard, but I appreciate that sort of specificity. So we will include that as well in our thinking.
Yeah, I would like to add, like for Region 1, the pre-licensing is like extremely difficult. They just back and forth. And honestly, if it's not that we understood English and navigate systems, there's a lot of potential early learning educators that are wanting to get licensed that are like going to be very discouraged. It's an extremely lengthy process now versus the way it was before, but I cannot foresee someone having a language barrier being able to jump through so many hoops that are coming out there and then the back and forth. So I think a lot of accountability needs to be set.
Thank you.
So, Polly, thank you for putting your note in, and thank you for coming to the meeting today as well. And you are a part of provider supports by attending this meeting. So appreciate it. And like Julie said, make sure that your name gets on the distribution list so you can get updates for all the upcoming meetings that'll be happening in the future.
Right. Can the CE team drop the email, their email into the chat for those that are not on the email list already? Thank you.
Hey, Tisha, I saw that you came. I saw that you. Oh, maybe she went back on mute.
Yeah, I'd like to suggest that that this group reach out to, I know Dave had mentioned earlier, like getting an email from your licensor, early achievers coaches. Some of these folks have, we all read those emails. We open them up. They're specific to us. So if they're sending something out to their caseload, they could include also your survey.
Thank you.
And happy to have anybody put any comments in about any of those four bullets that are there too. So
And we can move forward
yeah.
unless folks have one more. So here's our intent is to share a summary of what we heard today, as well as pieces that we receive in the survey back with this group. We'll work with our community engagement partners to have that be part of our communication loop for you. In the fall, we're going to come back out to different groups to identify the specific plan itself and get feedback on that. Would love to hear from this group the best way to do that kind of connection for this group specifically. We can send you the plan and ask for feedback in via email or forms. We can come back to this group, do a presentation, and have a verbal conversation. What would be the most effective or most desired way for us to come back to this group once the agency plan has been drafted? Excuse me.
If I might, I just think staying in touch with the community engagement team, and then it'll get figured out.
Happy to follow that path. And then we did have a request from some groups of having them be identified specifically as reviewing and or contributing to the strategic plan, either by name or by group or by organization. And so we are offering the opportunity for that to be true either as individual contributors, as this group, or not at all. And I figured I would leave that with you and community engagement to determine the best way to do that and honor whatever your guys' wishes are. So I will leave that with them. And when we start to go back and do our drafting, we'll check in with them to see if they've received any specific feedback around how this group or you as individuals will be recognized or not as contributing to the strategic plan. And that's our
Thank you.
time for today.
Yeah, thank you, John and Kendra. I really appreciate it. John, I don't know if you have a chance to stay on for 2 minutes here after we kind of close the meeting, just have one comment. So if you're cool to hang out for 2 minutes here, that'd be awesome. All right, my friends, thank you for joining us today. I think there's going to be one more Menti that Jessica will put up just for feedback on this particular section. And then if you have additional feedback that you would like to provide for the 4 bullet points that John and Kendra brought forward, that would be super helpful. You can add it there. I want to thank our interpreters that were with us all day today. Thank you guys for spending the time with us and for good reminders sometimes when we get going a little bit too fast. And just want to let people know that our next meeting will be on Wednesday, September 16th. And we will look forward to having you there, and we'll continue to work with community engagement to get the word out about that meeting to make sure that as many people as possible can participate. So thank you all and have a wonderful rest of your day.